Okay, well, welcome everybody to the Children and Adults Health and Wellbeing Policy Development and Scrutiny Panel. And I'd like to welcome everybody, and so this is a grouping of both councillors, co-opted members to the panel, and obviously officers and cabinet members as well. So, I would like to just go around the room and introduce everybody to everybody else. My name's Dina Romero, and I'm the chair of this panel. Liz.
Morning, my name is Liz Hardman. I'm the vice chair of this panel and councillor for Porton.
Thank you. I'm a councillor for South Down for doing that. Barrett. Thank you. And we will get your microphone fixed in a moment. Ruth.
Yeah, wait for you. Good morning. I'm Ruth Moy. I'm one of the Western Ward councillors.
David Harding, councillor for the Chew Valley Ward.
Thank you, Jo.
Hello, I'm Councillor Joanna Wright, Ward Member for Lambridge.
Paul Crossley, councillor for South Down.
Good morning. I'm Onkar Seri, councillor for Combe Down and a panel member.
Thank you. And now our co-opted members. Kevin.
Thank you. Kevin Burnett, representative from Professional Associations, NAHT, a non-voting member of the panel.
Christopher Batten, National Education Union, non-voting member. Thank you.
Thank you, panel, and thank you for telling us that whether you were a non-voting member as well. Sorry, Leslie. And Leslie.
Good morning, Leslie Mansell, Councillor for Rudstock Labour and Cooperative Party.
Thank you. I'm going to go from that end, so I'm going to ask Chris to introduce himself first.
Chris Wilford, Director of Education and Safeguarding for Baines.
Okay, and you also need your microphone sorting out then? Okay. Mary.
Yeah, good morning, Mary Kearney-Knowles, Director of Children's Services. Morning, Sarah Gunner, Virtual School Head Teacher.
Morning everyone, Laura Ambler, I'm the Director of Place for Baines at the BSW Integrated Care Board.
Good morning everybody, I'm Paul May, I'm the Cabinet Member for Children and Young People, and I'm a councillor and I represent Pensford and Whitchurch Village.
Jill.
Hello, I'm Jill Kirk and I am the Labour Group Assistant.
Thank you very much. And Mark.
Good morning everyone, my name is Mark Durnford, I'm the Democratic Services Officer for the panel.
Thank you. And finally, but certainly not least, Kerry.
Good morning, I'm Kerry Williams and I provide Scrutiny Officer support to the panel.
Thank you. So is there anybody here that I've not asked to introduce themselves, or anybody here whose microphone has stopped working? Good. Right, in that case then I shall turn to Mark to tell us all about what to do in the case of an emergency.
Great, thank you Chair. So, if the continuous alarm does sound, you must evacuate the building and proceed to the assembly point. From this room you follow the green running person signs to the exit, using either the marble staircase or the main staircase. Please do not use the lifts. The assembly point for this building is the Orange Grove grassed area just outside Brown's Restaurant. There is an evacuation chair for use by disabled people who so wish in the corridor outside the Council Chamber Public Gallery. Alternatively, the area at the top of the marble staircase has been designated a safe refuge where persons needing assistance should assemble. Thank you, Chair.
Thank you. And I just add to that that in the case of an emergency, just be careful on the marble staircase because there is a leak. And so there is water on the staircase as well. Okay, so apologies for absence and substitutions, Mark.
None, Chair.
Well, thank you very much, panel, for your entirety. Declarations of interest. Any declarations to be made here? If you suddenly think of something, then please make sure you alert me in good time when we get to that item. Thank you. Urgent business, I have none. Public and councillor statements and questions. You will note that we were expecting a statement, I think, from a member of the public, from Greg Hartley-Brewer. I would imagine he wanted to pick up on the matters that he made, or the comments he made at a previous meeting. I'm sure Laura's got this all in hand, and we will hopefully hear an update from yourself on this either later or at least maybe from Mr. Hartley-Brewer if he does attend in the future. So we were also expecting Councillor Eleanor Jackson, who is not here. I think there was some trouble coming in from Radstock, so maybe that's the problem. If she does arrive, depending on timing and where we, how we're doing, I might take her statement perhaps at the end of the meeting. Right, okay, the minutes from the 9th of September. Do I have any corrections to be made on these minutes, or are they broadly an accurate representation of what we spoke about? Okay. Are there any comments or matters arising, or perhaps requests for updates that haven't been received? Kevin.
Thank you, Chair. Thank you to Chris for sending around the separate points summary. I think it might have been Chris and Paul, but some of the points from last time. Just on those points for last time, though, I couldn't actually see you say the Community Summit presentation was attached, but didn't find anything attached, but maybe that's coming later somewhere. Excuse me. On page 7, we were going to get some clarity on the admissions criteria for the new special school, which may be to come. Page 12, bearing in mind whatever the timescale might be, some CQC feedback, that might be the next meeting. Page 13, the link for the age-friendly community framework didn't seem to find anywhere, and the winter pressures summary report. That's it from me, thank you, Chair.
Thank you. I don't know, Chris or Paul, if you'd like to pick those points up in the Cabinet's update, unless you want to answer them now, Chris.
Is that working? Yep, good. Just to say, if the slides haven't come through, they're coming through now, so I've copied you in directly with Mark. And also just to say on the admissions criteria for the special school, it will be like any generic special school that happens in Baines. The admissions are done through consultation through the Baines SEN team. So any out of area admission into the school and application that's made will come through the Baines SEN team, and we'll look at practice that. It won't be any different to how we do admissions for 3 ways or for Fosway.
Can I just, sorry, because I think the big issue, I think the question was last time whether places could be ring-fenced for Bath and North East Somerset pupils. Is that the case, or is it actually, no, you can't ring-fence necessarily, but, so that's what we were trying to clarify last time, sorry.
Yeah, so if a school does have spaces, we have the obligation to send a consultation from the out of area, but the bulk of the admissions into the school will come from Baines. You can't technically ring-fence through them as you can't from any school, but the bulk will go through Baines, and we will control the ones space which are there, but we have to pass on that consultation. So if a pupil from Wiltshire wants to go through, the Wiltshire SEN team would pass it on, and we would still have to go through that consultation process.
Thank you, that's what we were thinking. Thank you.
Thank you, Kevin. Thank you for asking for the clarification. David.
All right, thanks, Chair. Can I just follow up on that, Chris? So, I mean, I know it's not ideal for kids with special educational needs or any child to then move school. Would say a child comes into the school and is going to be there for a few years, if they placed him up in their local authority, would they then go back to their local authority, or would they stay in Charlton House School for the entirety?
Do we move into Charlton from another area, from Wiltshire? So there are different points, I guess, when you might look to change a place. I mean, there might be different reasons for it, but We have to remember that a parent or child may be very settled in their new school, and if we wanted to consult on changing placement, we would do that through the annual review process. There'd be an annual review, and we may talk to a family about there is a school which is closer, so it may be less travel time. But also we have to remember that may not be the right thing in terms of that timing for that. So it's, we can't force anyone to do that.
No, I just wanted to understand.
Thank you. And it's also something we could maybe look at, adding on to our forward plan, looking at school admissions and how much control we have as a council as well on that. And we normally do have a report come on admissions, don't we? But I'm not quite sure where we are with that in our normal timetable. Joanna and then Liz.
Hi, thank you. Free school meals. In the response, you said, I have checked with FSM team and we only know the number of eligible children who have applied, not the number who are eligible but haven't applied. So we know that in October 2023, 4,671 children were receiving a free school meal out of 27,624 within Baines. So what we don't know is how many children are eligible. And how can we ever find that out?
I don't know. It may be something that we need to speak with our welfare colleagues about, but I would assume our free school team would have done that. I can double check that, Councillor Wright. That's not a problem.
Well, looking at the criteria for getting a free school meal, you have to have an income of less than $7,400 a year. There must be a way that we can be asking that question. It seems to be quite an important question, and it's not very much money that people are living on to actually get by. So this is quite a serious issue. So I guess I see your response, but I think we're looking for a bit more action from the question.
Perhaps again this could be brought up as a whole item, free school meals, because I think there's also been a pilot, at least one pilot elsewhere in the country where they have put all the children, somehow they've had an arrangement with DWP and they've been able to identify all the children. So it'd be useful, I think, to look at that perhaps in more detail.
It is. It may be a more complicated task than just us being able to get that information, but we can certainly look at what it does. It may involve multiple teams within the council, but at this moment in time, the free school meal team do not hold that data. But it doesn't stop us asking the question.
I guess, I don't think it is even a political point. It's a priority that young people get a good meal to have education, and if they don't do well in school, full stop. So how do we support that within the Baines community? And I would hope that the Cabinet member follows that up. My other question is on how many ECHPs within Baines are not issued within the statutory timescale of 20 weeks after the decision is taken to carry out a needs assessment. It says that this calendar year, 25.1% of plans have been issued on time. Now, I'm not very good at maths, but taking that away, that makes 74.9.
Joanna, sorry, I'm conscious that we're
taking up time, but this is quite an important issue, that we know that over nearly 75% haven't been issued on time. And I think that this is a really important issue that we need to bring back to this meeting.
I'm very happy to do that, unless, of course, Paul's going to bring this up in his Cabinet member update, which he might do. Thank you. Right, where was I on my list? Liz, and then Leslie, and then Kevin and David. No?
Okay. Can I just say, I totally support what Joanna, Councillor Wright's saying about free school meals and eligibility, and I think it's one area we really need to look at in more detail, especially as the low number coming to assessment and a decision being made, 25.1%. How do we compare nationally with that? And I think that's a piece of work to be done. Secondly, it's just a matter arising, but it will affect us, especially when we're looking at our budgets, is that the government's decision to impose VAT on private schools will mean that some of our young people who, with SEND, are going to special private schools, and how will this VAT imposed now impact on us as a council?
Thank you. I don't know if Chris has an answer to that. Sorry, Chris, can you put your...
Sorry, just a couple of points. Just first to pick up Councillor Wright's point, the question about timely CHEs is a really important one, so I'm happy to have that discussion here or another time. And then the questions around the VAT on the private schools, I sent that response through on Friday to Mark, so I'm just checking that has been circulated.
It has, thank you. Thank you, Chris. And my apologies, Joanne, I wasn't trying to cut you down there. I just wanted to, if we're going to have a big, more detailed and in-depth conversation, I think matters arising is probably not the right place to be having it. Liz.
I've already spoken.
Leslie.
Thank you. First of all, on page 11, this is about the third sector. And Chair, you asked for a timescale on the next steps. Do we have that timescale yet? And also around engagement. There was supposed to be engagement. Has that happened yet? And what kind of timescales do we have in to make sure that this is sorted way before the next budget round, because this has been going on since February. I also wanted to pick up on page 12 around the free school meals. An answer was given that we don't know how many people are eligible for it. However, the funding for this comes from the government, so it won't affect our budget. And what has been done to find out from other authorities, which I asked 4 months ago, about how they are managing to ensure that all those who are entitled do get the free school meals. And I'm not sure if you're aware, but the Labour government announced that it's going to bring in breakfast clubs. And are they going to be funded by the government? They didn't go that far when I was at the conference, but that surely should help us. And also on knife crime, on page 22, clearly this is a big issue wherever you live. And again, I understand the Home Office is going to be setting up new youth hubs. Do you have any more information on that yet? Will they be funded? Is that to build on the current youth hubs? Or is it going to be something completely new? Thank you.
Well, Chris, what do you know about what government's doing?
Give me down to this one.
Shall I pick up the free school? There's another question there about free school meals. We did bring a paper back where we talked about the efforts the team go to try and make sure we promote the take-up of free school meals to the last scrutiny panel. But I can see there are still some questions there which scrutiny do want further clarity on. So I'll make sure for the next time we've got at least a good chunk in the lead member report to provide more reassurance around that. I'll also provide an update around the breakfast clubs as well and the work that's happening and the team around that. That's no problem. I'll pass over to Mary for the...
Yes, so just on the youth hubs, what the DFE have articulated recently is they're going to share a policy paper in November, and we're anticipating within that there will be an update on a number of things to include the youth hubs. Currently, the youth hubs sit as part of the Home Office funding, and it's a link to the work that's happening around knife crime and the Ministry of Justice. So we're due an update in November. I'm happy to share that when that's made available. Thank you.
Thank you, Mary. And then just coming back to your first point, Leslie, about 3SG, I understand that 3SG and Suzanne will, the Director of Adult Social Care, will be jointly presenting an item on this at our next meeting. So hopefully that gives some indication of that collaboration that is now happening. Paul.
If I can just pick up on that item, following on from the last meeting, we had a meeting with the Chief Executive and Chair of 3SG to discuss their concerns. The whole process has been that the officers have been looking at the nature of the voluntary sector and how it's all put together. And then they were just moving into the detailed work with the voluntary sector, which is now actually going on. So it was very clear that it was a question of communications more than any major issue in terms of working with the voluntary sector. So the process that I've agreed and Alison Bourne have agreed with the sector is that if they've got any issues, then they're to come to us and we'll deal with them, make sure that those communication issues are dealt with. And Mandy Bishop was very clear in saying, look, we're really worried about, the fact that this became, if you like, public, and therefore that we want to work with them, and we've now following that through in great detail with them. So I'm hoping, touch wood, that that won't be a further issue. But it is, of course, still driven by the fact that there are going to be savings in the children's sector, which have got to be worked through effectively with the sector, which affects both the voluntary sector and also internal services. So it's not an issue that you can just wave a magic wand, but it is something that we're dealing with them, and it has to be that we do that with co-production rather than anything being imposed. Because the simple fact is, we're much better. We've got a really brilliant voluntary sector in Bath and North East Somerset. And, when we talk about free school meals and Key Stage 2, it is important, and the government's picking it up as well. So I'm hoping that it'll be picked up later in November, that the early intervention is something that is absolutely crucial, and it's something that we all believe in, I think, in this chamber. And if the funding is there and if it's made statutory, then that would actually be a much stronger model for us to be dealing with it as politicians with the voluntary sector, because they do a really brilliant job.
Thank you, Paul. Leslie.
Yeah, can I just come back? Thank you very much for that, Paul. It's good to hear that some positive things are happening. The problem with the voluntary sector is they can't run like the council. So if they haven't got the funding in before the end of the year, they don't know if they can issue contracts to their staff. And if we're not careful, we could lose some of those, as you've just described, brilliant voluntary sector organisations. Before it was mentioned about interim contracts, have they been sorted out? And in fact, what are in those as well? Thank you.
So, Paul, you may not be able to answer all of that right now, but I would say that that would definitely be part of what we would expect to hear when we hear back from Suzanne and we hear back from Becky.
And I can help a little bit with that, because where necessary, we've extended some of the contracts to make sure that the process can be dealt with effectively by the sector. If you remember, it was, I was going to say, a saving was imposed in this year, but what we've actually done is a proper analysis of the implications of those cuts, because the voluntary sector actually overperformed in many areas within their existing contract, and if you then start applying cuts, then there could in actual fact be an increased cost coming into our system. So under those circumstances, we would then go back and say such cuts would not actually be cost effective. So it is a process that we're actually working through with them. And it's not something that's just being imposed on day one, as we had feared at one stage in the discussions. So we are actually working with the Cabinet member for resources to actually deal with this in a sensible and correct and proper way.
Thank you, Paul. So, Kevin, you're going to be my last person who's going to be talking about matters arising.
Thank you. Only really to add to excuse me, the free school meal item. As school leaders, we've been pushing for an awful long time now, because so much other funding is tied up with free school meal eligibility within schools, and we have asked that the regional directors, the MAT CEOs, whoever's the SSB, whatever power and lever we can get, the DFE do know, because of the benefits criteria and things, how to register people and get that information out. And they should be automatically getting this information out to local authorities and schools, and so that families can benefit and so can schools.
Thank you, Kevin. It was a point I was going to hope was going to be brought up when the next report comes back on free school meals, that link with particularly pupil premium is really clear as well. Right, okay, we're going to move almost seamlessly into the Cabinet Members' update. And are there any other points you want to add to your report that's already been circulated, in addition to comments that you've made earlier as well, Paul?
Just start off by introducing Sarah. Many of us know Sarah well, but this is the first time she's been to the PDS. So I'm sure you'll treat her with due respect, even if you don't treat me that way. The simple fact is, it's a big welcome to her, and she's dealing with the item around attendance and exclusions later on the agenda. I think it's quite a long report this time, Chair, and it's mainly updating on many of the big issues that we've been talking about. Safety valve is a black hole that the government has inherited from the previous government, of something, the reports are anywhere between 1 billion and 4 billion pounds of money that's being held off of council books, but if they actually then brought those back onto the books, they would probably put most children's services out of business, if not the local authorities out of business. So it's a big issue for the new government, and we're awaiting proper attendance about that in the future, but the DFE is still talking to us, so we're actually then able to move forward with our revised application. Yet, I think this is the third one, isn't it, Chris, that we've now put in, but the residual issue is still there, that if you get the funding around safety valve to actually improve the services and get them down to basically cost efficient, you're then going to find under the current rules that the large sum of money that's held off of the council's books would then come back on the books. So this is being dealt with by the Chief Executive, and he's dealing with all the Chief Executives in the South West, because it is a major issue in terms of how local authorities perform in the future. On Culverhay, the progress about clearing the site and moving ahead, I'm going to be pushing to get a progress report on that, Chair, because I think it is something, it's one of the major issues about how we can move forward and making sure that we actually follow through the commitments we've given to the communities up there. And on Charlton House, I'm really, I've said that the scheduled time for this being ready and for occupation is September 26th. And if you remember, I brought the item, the single member decision, to your last meeting during the adult section, which is why there were a few queries which Chris was probably unaware of, and that's my fault. But the simple fact is that that's a long period of time for an existing building. So I've been just trying to push to make sure that we actually get that building occupied as soon as we can, because not only is it good for parents and their children, but it's also good for the finances of the local authority. And if you remember, the total savings was something in the order of about £4 million a year, not necessarily all directly to children's services, but it would be a major issue from our point of view. Are you going to let Councillor Crossley in, or shall I carry on?
Well, I was going to let you get to the end,
Okay.
and then I was going to bring in questions, etc., and comments.
Okay. If that's the case, then I'll try and deal with the queries as they come up.
Sorry, I was letting you get to the end, and then
Okay.
and then we can answer, because you might suddenly come back and go, yes, I forgot to tell you this.
Right. So the other one then is every year we have an Ofsted annual report, which we do a self-assessment, and we feed that information back. We have a detailed discussion with Ofsted around that. If you remember, this authority is rated good in all elements of the previous inspection that was held, and every year we give an update about how things are going. Since the last inspection, the issue around send has been a big issue for us, which is why that's a priority for the way that we're actually dealing with things. But they're going to be changing their system to doing an annual discussion with us around social care, but also they're then going to go to termly for education. So I think that that's going to be something that we'll try and keep the committee fully informed about. I wanted on corporate parents just to say that meeting was well attended, but I think many of us felt really quite uncomfortable at that meeting, and that I've then going to follow up that, because I think this council chamber is scary if you're first presenter here, but we having children in, it was really totally unacceptable, I think, for those children, and I felt really uncomfortable at that meeting. But also, if the report was put to council, the leader of the council said we should actually, in fact, be talking about with policy and scrutiny committees around policy issues. A policy issue has come up which I thought would be really helpful if I could ask Councillor Wright to talk about the question about the sycamore tree, because that would be something physically where we'd be supporting young people that have been care experienced or in care. And under those circumstances, I'm also going to have a discussion with you, Chair, to see how we can, in actual fact, develop up different policy initiatives coming from the committee to me as the Cabinet member, as opposed to sitting here and us just talking at you. So it would be much more in the future, hopefully, that we can have a two-way conversation. Because I remember, David, that you mentioned things around within schools and air conditioning and things like that, and how we can, in actual fact, look at different policy issues moving forward. So could I, at this stage, just ask Councillor Wright if she'd be happy just to talk on the issue of the sycamore tree, and then I'll carry on with my other points as quickly as I can, Chair.
Okay. Joanna?
Right now? Okay, thank you. Yes, I'm sure some of you are aware that last year on Hadrian's Wall, a sycamore tree was felled, and they have now created saplings from this felled tree, of which there are 49, and people can apply to have them put in public spaces for the good of their community. I'm aware through attending corporate parent events that one of the things that we've discussed is how children who are looked after or in care want to have a visible place within Bath and North East Somerset that identifies that they belong and that they are cared for. So it occurred to me that this cutting down of this tree is about loss, but also about hope, and that we could apply to have one of these saplings and put it into a local park. In my role as chair of Alice Park, which was given in trust to children to play in, it seemed to me to be a relevant park for that public space. Others might have another location, and I'm happy for that. But in the short term, there is a deadline to apply for one of these trees, which is the 25th of October, and we might not be successful. But it was just a way of thinking about how do we make sure that those in care experience are given a particular place in which they can go to and feel that they are part of our community indefinitely.
Thank you, Joanna. I'm sure between you two, you will have also been speaking to young people to find out whether or not this is something they would be supportive of as well.
Yeah, I fully support this, so do the officers, but I thought it would be really helpful in terms of that application going in if the committee actually got a minute saying that they support that, because I think it would be something positive, because it is a bit competitive, and I think under those circumstances it would be really good that the Cabinet member, the officers and the committee actually all support that. But I think that would be, if we could have a minute to that effect.
Yeah, I'm seeing nods all around, so I think there is support there. But could you just confirm that our care experienced young people have also been included in this request, in this submission?
Thank you. So, shall I move on then?
Sorry, were you saying yes or no, that they have been included in the submission? Have you asked young people whether this is something they too support?
I've asked the Cabinet member to take that further. I mean, I just put the proposal to them and left it with officers.
So I understood that, yes. No, I was asking the Cabinet member if he could make sure that care experienced young people are included in this request.
I'm sorry, I've picked up your point now, Chair. Yes, of course we will. I think that's a very good point. I mentioned at the last corporate parents meeting that I was going to meet off the record following on from that meeting. Unfortunately, the lady was poorly, Sarah, but I've now refixed a date in the diary, so I'll also then follow that up with her. I think it's in about a week or so's time, so it is a question of timing, but we will make sure we pick that point up because I think it's a really strong point. So moving on then, if I can, the other issues is that we've been talking about children's services, young people moving outside of the area to independent providers, which has been a really quite expensive and difficult situation for many young people. And the new government have indicated that they're going to be providing some support because the pendulum has swung from being local authorities moving away from providing children's homes into actually then seeing the cost of doing that. And now the pendulum is moving back again. And we're in discussions about how we can actually do that. And there's a business case that's been prepared through to the Chief Executive to look to see whether we can actually create probably 2, if not 3 homes where we can actually take children who are outside of the area back into the area, and we can provide children's home provision for them. It's not something that we've currently got experience with, so we will probably need to get some external advice on that process. But I think it's a positive that is coming forward about how we can actually deal with children better in our own area. There's a lot of corporate support for that, which I think is really good. I put an item there on about school streets. That if you remember, we had Andy Waite, the chair of the PDS, came along and gave the commitment that they would, in actual fact, continue to push with school streets. They've now agreed, as I understand it, that there's going to be one street done this year, and under those circumstances they've gone out and sought volunteers from schools, and they're doing that analysis, and as soon as I hear something more positive, I'll be reporting that back as I promised that I would keep in touch with that. And it falls within Sophie's remit, but Mandy is picking that up for me, making sure that this committee is kept informed around school streets. I think, just moving on then, I think the other one that I wanted to just make mention of was that next week we've got an inspection of the Youth Justice Service, which is a major inspection, and we're gearing up for that as best we can, and hopefully we'll see how we come out of that. But it is something, as soon as we've got a report back on that survey, that inspection, we'll report that back to the committee. And I think the other one was that we had a review that was carried out by the CQC and Ofsted around transitions from children's services into adult services, which was a thematic review. We were the only one local authority in the southwest that was interviewed, and as soon as that report comes back, we'll make that available. I've given that commitment that we'll make that available. That'll probably be the November meeting. And it wasn't that you were going to get a decision from that inspection saying you're good or you're bad. It's just picking up the key issues that they've picked up, and that's driving a national rethink about how the legislation, which is very clear around children's services and adult services, but how those transitions work for people. And we're talking about safeguarding later on in the agenda, and this authority deals with the safeguarding for both children and adults, and I think that's a positive, because other areas often keep those two safeguarding separate. And we do make that commitment moving forward. On the Health and Wellbeing Board, I've just put on there some of the reports that came up that. So there are public minutes of those, but it was good to see Leslie at one of those meetings. They are open meetings and people can attend. So I think that's really good. And finally, just the children with complex needs. That's something which we are in discussions with our health colleagues about the top 20 cases that we deal with in terms of the most expensive, and we need to make sure that moving forward with the joint agency partnership that used to be there, to make sure that the funding is correct between us and health, because particularly around mental health, there are some issues there that we've got to make sure that moving forward that we're dealing with that in a constructive way. Otherwise, I'm more than happy to try and take questions on the rest of the report. I'm sorry it's such a long one, Chair.
No, thank you. It's very good to have such a comprehensive report. I think what I'm going to do, and I haven't warned the panel about this, I'm actually going to go through each part and just see if the questions on each bit, otherwise it's a bit sort of, could be a bit choppy and changing. So I'm going to leave the exclusion and attendance report till we get to that item. But if I could just ask panel if you have any questions on safety valve for a start. Liz and then Kevin.
Paul, I still have some concerns about safety valve, and I know we've got a new Labour government, but I think the rules at the moment are still the same, and we're still operating under the current system. This is the third time we've had to resubmit to obtain this amount of money from the DFE, and do we actually know what is actually required? I mean, have we ticked all the boxes? And we're one of 6 local authorities out of all of them that have had to resubmit, so I am concerned about it, and I do wonder, obviously we have targets to meet, and if we don't meet these targets, will we have to repay the money? So just a little bit concerned. I know you've said it's just a bit of tweaking is required, and I just wonder, is it more than a bit of tweaking? Thanks.
Okay, so before you come back on that, I just want to check if there's any other questions. So Kevin, I think you had a question on safety valve. And then Joe.
Yeah, thank you, Chair. It was just around the good news that the SEND and AP advisory service was now well underway, which is good stuff. Just wondering how the local authority are going to gather feedback on its effectiveness, both from schools and any other places you may be gathering measurements from.
Thank you. Joanna.
Hi, thank you. Following on from Councillor Hardman's point, how have you been asked to update? You keep telling us you've been asked to update, but there's no information here.
And I'll just add my question, which is actually, can you give us a bit of the headlines around that, what the revised application is seeking to obtain? Okay. Chris or Paul?
I'll try and deal with them. I meet the team that have been doing this work every 2 weeks, and we've got a follow-up meeting this week, today in actual fact. The issue is around the details of the submission that's been made, and I'll pass that over to Chris to deal with that. But the simple fact is that we've got a really good working relationship with the Department for Education, and the number of other areas that there's been queries The only one that I think that is in the southwest that has progressed has been Wiltshire, but they accepted the issue around repayment of the capital sum because their situation, I think, was slightly different to a small authority like ours. But that is an issue that's moving forward, and I'll get Chris to deal with the detail of that, if you don't mind. On the feedback with the AP service, I met the new head of that service, and we've agreed that we would do a feedback in 6 months' time to make sure that we actually do provide the support to the schools that the schools actually need and want, because it's mainly a professional support service that we're offering, and I think it's the reaction so far from Senco's has been entirely positive. But it does mean that with new Sencos coming in, that will be providing training, and the schools at the moment it's an open door. So I think we're hoping that that will actually continue to be really positive. And I'm more than happy after that feedback, after 6 months, in bringing that back, because I think it is something that has been needed. I think it's a symptom of the fact that so many of our schools are within multi-academy trusts, and that has meant that, to a certain extent, we've lost that connection between the local authority and those schools. So I think it is something that has been really important, and is, at the moment, just seems to be a really good news story. Joanna, I think I'll leave that for Chris to pick up that. And I think hopefully it's the purpose of safety valve is they've paid out, I think, about 11 million so far, and it's just part of the money that's been put on hold. So we need to actually carry on working with the Department for Education. But can I pass you over to Chris to deal with the details, if you don't mind, Chair?
So could you just clarify, they've paid out £11 million to this council?
Yes.
So they're all really important questions, but just to take them one at a time. So the third submission was just tweaking what was put in for the second submission. So the resubmission was done, and then the day after an election was called, and a significant amount of time has passed, and we've had no official steer from the Department for Education on what happens next, simply because we're in an emergency policy environment. We don't yet know what the Labour government's approach is going to be to special education needs and funding. I contacted the team to say, can you update us on our submission? Can you tell us what's going to happen next? And they weren't able to advise at this stage. On the basis of that, I said, you're welcome to go back and revisit any parts of your second submission, which may have changed over the 3-4 months that have passed since then. A couple of our projects in our capital plans have changed in terms of the resource bases, so we amended the details about the resource bases and we updated the plans, and then we resubmitted it again. At this stage, we don't have yet a formal position back from the Department for Education on what will happen next, and we await that position at this moment in time. We're in a draft plan stage. We did bring some information about the main aspects of the plan back to the panel. I think it was in March. I'm more than happy again to come back here. I think there's some really interesting things that we're doing in the safety valve around our capital plans. So, the panel has been briefed on the special school and Charlton House and the resource bases that we're helping to develop. We've got some significant investment in services to support children earlier, which is an AP advice service. So we're doing a lot more work to support young people earlier and Sencos. How Sencos will give us feedback, because it's predominantly that service, is predominantly a service for professionals, is that when they contact the local authorities via a web form, so that we can get all the information we need about what it is they're wanting to get advice about. As part of that, they can also then offer feedback to us on how that service is being received. We also meet regularly with our parent carer forum. Members of the team spent a couple of hours in an evening recently going through some of our plans, but also going through the Send and AP advice service. And that was really gratefully received by the parent carer forum. we're actively looking about how we can involve more parents in helping us with our service delivery. So there is a lot going on in relation to the delivery of what I think is going to be some really interesting and exciting things for us, how we managed send in veins. The demand is really, really high at the moment. This year we've had over 600 applications for education and healthcare plans, which is 110% more than we've ever received. It's the highest year. And manage that demand does provide a real challenge for us. But we think with the offer of additional help from the Send and AP Advice Service and the support that we've put into the Send team, so part of our plan was making sure we've got a fully functioning SEND team. And I know our timescales at the moment are not where we'd want them to be, but they will improve. And we've gone through a full business change process with the SEN team, and that is part of our safety valve plan as well. So there is a lot of what we have planned, and we brought information back to the panel, is what we're delivering. What we're at the moment is a bit of an unknown space with the Department for Education, because we don't actually know yet what the formal response will be from the Department of Education. And as soon as we do, I'll be able to update this panel, and Paul will be able to provide additional information about that as well.
Thank you. Paul.
Yes, I'll be a bit more specific. I don't believe that the issue is that we're not performing as well as other authorities in terms of the DFE. I think they've been really in quite a difficult situation with the change of government and without any clarity around policy at the moment. So I think at the moment they're just pushing things off a little bit, and we're trying to deal with them as effectively as we can. What the DFE have done is they've actually created a post in the southwest of a research assistant that's looking at all the DFE bids that have come in, and that person is Dr. Vicky Jarvis, and I think she's based in Torquay or somewhere like that. But there is some research information, and if the committee would like it, Chair, I'm more than happy. There's a presentation that she's done, which she did to all the lead members in the southwest, which was sort of an hour and a half. But I asked her if she could, in actual fact, simplify it down so we could, in actual fact, show some of the key statistics to the committee, if the committee would like that at a future date, because I think it's really quite stunning. And when you compare the southwest to other parts of the country, in actual fact, the southwest is actually got more problems than the other parts of the country. And I think it's the nature of the fact that in the southwest, many of the schools are in multi-academy trusts, and that does, I think, affect the picture with regards to SEND. And particularly, which is why the new AP advice service is really important, because if schools don't know how to deal with children, difficult children, if that's the right way of putting it, then they can then refer them on to the local authority. So we are an outlier with the number of referrals that we get as a local authority, and it is important that we actually recognise that that's a picture that's across the southwest. And you know, our neighbour, our next door neighbour, North Somerset, have similar problems to ourselves. So there are issues there, I think, across the southwest. So that information, that research information, is really quite useful, and I'm only too pleased, if you would like, I'll bring that back to this committee.
Thank you very much, Paul. Can you turn your microphone off? Can you turn your microphone off?
Sorry.
Thank you. What I was going to ask is that we could have an update then for our December panel meeting, because I think it would also be very timely, because that's when we'd also be looking, I assume, at our sort of the emerging budget proposals as well. Okay, so Chris is nodding for your records there, Mark.
I would hope we'd have some sort of position on from the Department for Education on safety valve at that point, but we can certainly update on the plans because we're delivering them.
Thank you. Okay, so then the next item that you had on your report was the capital update about Culver Hay. Were there some particular questions on this item? Joanna and then Paul.
I was on the previous item. There seems to be a real issue about multi-academy trusts, And I wonder how we ever bring them into this room, because we hear lots about them doing stuff, but they never represented within our space. Yet they have a huge impact across the young people that live within us. So how do we actually bring that to this scrutiny panel?
I think that's a very, very good point, Joanna, and I think maybe at one of our next meetings we will have an item on multi-academy trusts, and perhaps also we might get some idea of the thinking, perhaps government might be changing their thoughts about their impact and service. Chris.
We have had a representative from the Regional Director's Office come to this panel before at the panel's request, so we can certainly ask that. When I presented the last education performance report here, and we were so disappointed with some of our outcomes around Key Stage 2, I went to the Standards Board the following meeting and said, some of you, my colleagues from the Standards Board, can come and sit in this seat with me next time we do that. And they did volunteer to do that. So I'm sure when we do the education performance, we can ask them to attend. However, they aren't accountable to us as the local authority anymore. It's to the Regional Director's Office. But I will certainly make that question because I think it's a really good one.
We have the ICB here why shouldn't they come every time?
Do you mean the RD office? Regional Director's Office?
Thank you, Chris. So we look forward to the attendance of our representatives from multi-academy trusts. A regular attendance, maybe. Paul.
Chair, can we be very clear? Because the Department for Education deal with the multi-academy trusts. So I would suggest that it's the Department for Education that you need to have the discussion with, not because I don't know how many multi-academy trusts there are. I mean, they would start to fill up this council chamber. So
I was looking for in the first instance
by the Department for Education.
In the first instance was, I think, something that clarifies the role that they have, how that accountability chain or lack particularly for local authorities. And yes, to have that ability, I think, to raise the concerns that we raise quite often. So we've moved on to the next item, which was capital funding. And so I had Paul, I think you wanted to speak here, and then Kevin.
Thank you very much. Yeah, Paul, you'll probably guess what my question is. In your report here, it would seem, despite the fact that we raised it at the last time you're here, and we'll raise it every time you're here, the Culver Hay swimming pool is a very important asset to the whole of the population of South West Bath. And in fact, when it was open, it was also served a much wider area than that. People who used that as a pool rather than going to Keynsham or to the small one at Poulton or into the centre of Bath. So when you met with the Department of Education for an update, was the requirement or the request that we looked at how we keep this pool in operation as part of the sports centre raised, and if not, why not? Does that mean, if it wasn't, does that mean that the Cabinet has dropped all plans of trying to keep the pool open?
Thank you, Paul, for taking my question as well. Paul. Oh, sorry. Let's have all the questions about Culver Hay first. Any other questions on Culver Hay? Kevin, was yours a Culver Hay-based question?
No, it was on the Charlton House capital bit. Thank you.
Any other questions apart from me on Culver Hay? My question then is, so you talk about moving the operation from the Culver Hay site to Dartmouth Avenue. Have you considered the impact of the current RPZ that is literally just on the other side of, under the bridge there, and on the ability, I suppose, for all those staff that are currently drive to Culver Hay, to the Culver Hay site, will there be sufficient parking for them? Because there is a huge amount of pressure on the existing parking spaces in that area. And I apologise, it is a slightly parochial question, and I speak as a South Down councillor.
The second, your question, I'll see whether Chris can help me out on that one. I just don't know for an answer on that. With regard to Paul's question, we've been very careful to try and make sure that in those discussions that we think about the issue of the pool. It isn't something which is really easy to make a simple decision about, because the overall site is in the hands of the corporate property team, and all I can actually say at this stage is that I've been pushing to get a report coming back to Cabinet around the whole issue of the site and how it's being dealt with, because there's the opportunity for housing, there's opportunity for education, but what we've been trying to do is to keep those discussions moving forward, and the opportunity of having a thermal pool is in part of those discussions, but a swimming pool, we had to actually try and make sure that we kept the opportunity open in the future for a pool on that site. But the overall planning of the site is something that Chris is working through with the head of Simon Martin, the head of corporate property, and we're trying to keep that issue forward, but not actually at the moment. We can't make an absolute promise around it, because the officers said that despite what Councillor Crossley's saying, that there is no need, no demand for a pool in that particular area. So we've got to deal with that issue as effectively as we can. And if you remember, when it came to Cabinet last time, we had to change the report the officers put up to actually make sure that that opportunity was left there in terms of the planning of the overall planning of the site.
Chris, I also would like you to pick
the
up...
other...
Well, I will come back to you in private on that, because it's completely outrageous about what officers are saying.
I can only report what the officers are saying.
Well, my comment might be actually what you might have said, but I wondered if Chris could also address this point about the community consultation around the pool as well, because that's certainly not what I've been told by the community. And also address this point that Paul raised about housing on the site as well. So I don't think we've heard at this panel before that there is a likelihood that there'll be housing there too. Chris?
I believe we're looking at whether we can support the bill to make sure it's got leisure facilities which the community can access on that site, which would be joint leisure facilities between the two schools. That's something, a model that the DfE have worked through as an option before. We have talked about that there is currently a pool there. Whether that can be replaced or not, accommodating the site is a question mark, but there would certainly possibly be the opportunity to have a therapeutic pool, which could be bigger and accommodate some lessons for people. Whether that could be a full-size pool would be a very difficult challenge, I think, but it's certainly one which we know that we'd want to work through the DfE. The DfE are quite clear with us that any additional facilities that would have to be in the site would have to be at the council cost, so we would have to work with the DfE's team on what that might look like in the future. We haven't got to that design stage of the two schools at the moment with them, so at the moment we're only at the beginning stages, and we are focusing on the clearance of the site, which is being held by the property team, so that's the piece of work that we're working on at the moment. What was the second question, sorry, Dina?
My question was about parking.
Parking, yeah. I don't know. It's a really good question. So I've just asked my colleague, Olwyn, if she could update me on the parking situation in Dartmouth.
Thank you. And apologies a bit for slightly making this a Southdown related item. I think we can move on now to Charlton House, unless your question is about clarification. Okay.
Sorry, perhaps I should probably know this, but from looking at your report, so is the moving the alternative provision school to, or possibly moving it to Dartmouth Avenue, is that just an interim measure, or would it remain an interim? Thank you.
Quite clearly an interim measure.
You've got agreement with the current users of that site as well, I assume?
The site is being vacated by Bath University, or Bath Spa. It's one of the universities which currently uses it, but they've already given notice and their intention to leave, so it becomes vacant and it's a local authority property.
And to be specific, the proposals around Culverhay is the free school, but also the AP provision for 55 places. So that's the long-term aim, to actually get that. And the advantage that we get by having those two provisions on the site is that we can then actually try and negotiate as much as we can for the general community for out of hours, so that they can be used more effectively.
Thank you. So we finished with Culverhay for now? Right, then we'll move on to Charlton House. So do we have questions on Charlton House? Kevin.
Thank you, Chair. Yeah, a couple of questions. First one was who will eventually decide the outcome, the successful provider will be, who decides that successful provider. And the second thing was, again, around possible clarification. It said in the minutes that there were, last time's meeting minutes, that £6 million was coming from the DSG. I was under the impression initially that the Charlton House residential school was being paid for by a grant, separate grant. And the bit about the DSG kind of worried me because I didn't know seeing anything, and of course DSG tends to be ring-fenced. So if we could have some clarification around that, that'd be fantastic. Thank you.
Any other questions on Charlton House? Liz?
Paul, in your report you stated that there was a consultation event for the 1st of October. Who was invited to this consultation, and how wide was it? Because this is the first we've heard of it.
And finally, Leslie.
Liz has covered it, thanks.
Right, so back to you, Paul and Chris.
So the consultation event was the tender that the Department for Education advertised to potential providers. So that was for schools to come and put an expressed an interest in whether they would provide, want to be interested in running the accommodation. And to come back to Kevin's question, it's the Department for Education who decides, has the final decision on which trust or academy will run the school. It's called the presumption process. So schools applied to do it, and the consultation event was for providers. We only got one trust that came forward to that consultation event. However, since then, 2 more have come forward, which is really good. So we've got 3 potential local parties now, which is really exciting. And Kevin's absolutely right. It's I wasn't at the last meeting, but it's not the dedicated schools grant that's paying for the school. We bid for, as part of the safety valve programme, we bid for 4 million addition with capital, and we also had 2 million which we're using from our SEN capital budget, which is also provided each year by the Department for Education. Not the DSG, just to reassure you, Kevin.
Thank you. Any other questions on Charlton House? Leslie? It had been. In fact, I've gone back on myself, haven't I? Okay, Ofsted annual conversation. Any questions on this item before we get to there? Paul, I assume, wants to come back on something.
Yes, sorry, Chair. There is going to be public consultation, and what I'll do is I'm in discussions with Olwen around how we're doing that the next stage when we're going for planning permission. So I'll make sure that the committee, through you, Chair, is informed about that public consultation so that you can be involved with it, because I was aware that there was issues around the closure of the adult sector, and it is important that we do actually do that public consultation effectively.
So just going back a bit, is there a public consultation then on Culverhay?
I think when we probably get to the design phase of that piece, yes.
Right, so back to the Ofsted annual conversation. Any questions for Paul and Chris? Onkar.
Thank you. So on Ofsted annual conversation, so how will the new termly conversation with Ofsted regarding education be used to improve the quality of education services in the local authority? So that's the first question. And the second one, that's on just in general, like Ofsted inspection. So what specific areas of strength were highlighted in Ofsted report, and how will the council build on these successes? Thank you.
Any other questions on Ofsted conversations? Okay, Chris? We decided which... Oh, Mary's going to speak.
I'll respond if I can and give Chris a bit of a rest. So just in terms of Ofsted, so there has been a huge piece of work done in the last number of months where Ofsted have undertaken what's called the Big Listen, so they did a big consultation around how they engage with local authorities and how they engage with schools. So they've confirmed that they will continue to have an annual conversation with regards to social care performance. So they will look at all areas around safeguarding. So there's no changes to that. And we do what's called a self-assessment each year. So we self-assess against a set of standards that Ofsted have outlined in terms of their inspection framework. So we will continue to do that. And that's generally a face-to-face conversation at their Bristol offices. What we have had is informal meetings around education with the education inspector. Actually, I should go back and correct myself. That annual conversation is with the regional director for Ofsted. So then separately, what's been reinstated is a termly conversation with the director of education and the inspector for education within Ofsted. So those will now be termly from this term moving forward. So that is a change. Last year, I think we had one meeting, Chris, didn't we? We had a joint meeting around education. So again, that will be looking at particularly around our maintained schools, but also looking at our safeguarding arrangements, because we are still, obviously, we need to ensure that all of our children are safe while they're in all schools, so we retain that responsibility. So that's the manner in which that will go forward. Okay.
Thank you, Mary. So next item part was corporate parents. I don't know if anybody had any questions. Leslie.
Yes, thank you for including this in the report. I think this is really important because that meeting just didn't work, unfortunately. And while there were a lot of councillors there were only 5 young people, and they were actually younger than the group that we met with last year. For me, I was quite embarrassed because I felt, it was like that scene from Alice in Wonderland with the jury at the end of the story where these young people came along expecting to perform, and clearly they were very uncomfortable, they were not happy, and that then translated to us. And I also thought some of the questions that were asked of them were quite inappropriate. They had asked us a question about what it meant to be a corporate parent, and while that may be defined, then I think it's something that we ought to have a further discussion on, so we can be clear about what our role is. It's one thing having the legal requirements, it's another thing putting that into practice and in a way that's meaningful. And I think for me, I would like to see better engagement and more inclusion with the children looked after and the care leavers. I think it's interesting the suggestion that Joanna's made, but what is important, as you've raised, Chair, is having that discussion about what the young people actually want. I chaired Freedom Youth for 5 years, and one thing we did was we invited 2 young people. We had a young woman and a young man who came along to our committee meetings. They talked within their group, and they came along and they asked us for various things. Now, there's one thing about getting them to move away from paintballing, which was a big favourite at the time, but having those, positive conversations that were really important to them. And I think policy is important, but they will probably regard it as boring. But when we were dealing with young people that were dealing with, daily homophobia in schools, then what we could do was at least teach them to cope with it and deal with it, and set them on their feet so they could go out and be useful within the economy and in social life, and not be suppressed as a part of that. And I think for looked after children, they're in a similar position. We know from reports we get that and the figures that we have, that they have worse life chances. They're less likely to go to university, they're less likely to get into a well-paid job, etc., etc. So what I suggest is we have a conversation between us about what that means to be a corporate parent and what we can do to improve that, how we then improve the engagement with young people. As I said, this year, the ones that came along were much younger than the ones the year before, so it's a very different scenario to work with. But we do have to think about how we work with that in a meaningful way. And the other thing is there is a desperate need for some more meaningful equality training for all of us. I think the mandatory is okay, but we need more that's very pertinent, that we can think about how we put that into practice. Thank you.
Thank you, Leslie. Really, really good point. Joanna.
Thank you. I'm picking up with what was said by Councillor Mansell. In terms of that meeting, we've said that it was well attended. I don't actually think it was that well attended. We are, 57 councillors and 59 councillors. Rarely are there more than 20 councillors at that meeting, if not less. Many councillors have not attended a corporate parent meeting, and I don't think that's acceptable. One of the things we have been trying to do in the Green Group in terms of the Constitution review is actually demand that every councillor has to attend one meeting a year, and if they do not, then they stop being a councillor. And we were given a lot of pushback by by Democratic Services. We've now managed to get that actually as an item to be on the agenda. But thinking about what this remit of this committee is, which is almost to set up policy, is that why aren't we working as a work plan to put in policy for corporate parenting that ensures that all councillors have proper training, know what that role is, and attend one meeting a year. And that should be in our constitution. And what is the point of having a constitution if we can't put the things that we want in it? And there doesn't seem to be a proper dialogue in this. I am quite vexed about this, because if we are instantly elected and then told we're a corporate parent, there is very little piece of work that goes around that, and there should be better support for us and to ensure that we deliver for them, and that is not taking place. And I agree that that particular meeting wasn't acceptable to the young people that came in to it, and some of the questions that were asked of them. So this is a very serious issue about protecting people when we today have a safeguarding issue ourselves. We have to question ourselves repeatedly, and councillors are not doing their job.
Thank you, Joanna. I wonder whether or not at a future agenda within corporate parenting, whether all of these points can be examined and maybe a way forward be worked up, because this is not new. This is an age-long problem, and we need to find a better way of being able to be corporate parents, and also to find better ways of listening to children and young people who are experiencing care. Councillor May.
Thank you, Chair. I want to thank Leslie for her question, because I think it was very, very relevant. I felt embarrassed at the meeting, as I think probably most people who attended did feel. And Councillor Wright, I mean, there were more people attended that meeting than normally attend, which is why I was saying I was trying to be positive rather than negative. What I'm doing is, as I said, I'm meeting off the record in a week or so's time to discuss how we can organise that better for young people. We did have older people there at the previous meeting, and every other meeting has the children come along. But also, we've invited down the national lead for corporate parenting, who's coming to the next meeting. Under those circumstances, I think these sorts of questions could and should be asked of the national lead, who's really quite inspirational. And if we can improve things, then we can actually try and learn from what's happened. And try and change things as we go along. The other thing that I would just say is that in terms of corporate parenting, I think the council's induction programme for new councillors does cover corporate parenting. There is training given, but everybody's got busy diaries, and it is difficult. And I can sit here and complain, and so can the committee. But how you get that actually implemented, I think, is going to be, let's learn from other areas of how they're doing it. And if there's new ways that we can operate, then my door is very much open on this, because I think you're quite right, Councillor Wright. This is a badge then for those young people for the rest of their life. And we've got to make sure that we do the best that we can as their parents, because they are our children. And under those circumstances, if it's not working very effectively at the moment, then that's something that we've got to take on board and try and change and do the best we can. Whether we can force councillors to attend, I don't think that's feasible, but I do think we've got to keep the pressure on, and group leaders come into this as well, I think.
I agree with that, and I mean there is ways of amending the constitution so that actually at least one meeting is compulsory. Attending one meeting, is compulsory, and you just have a look at what we do. If a council doesn't attend any meeting for say 6 months, then it is questioned whether or not they are fully able to carry out their functions as a councillor. So there is precedent, I think, so it could be looked at. Maybe the Constitution Working Group could consider this. So I've got Kevin, then Joanna, and then Ruth. Kevin.
Thank you, Chair. I was just wondering if the role of I may have got this totally wrong, so apologise, but there was, I thought, an ambassador for children, looked after children, who was appointed with the council, or a young person's ambassador, and whether they have a role within all this as well. And my only other comment on what's just been on the discussion is that obviously if something is extremely important as corporate parenting has a particular issue to actually overcome, like training or whatever it might be, then I think as school leaders we would say we would have no excuse if we had a conversation with Ofsted as to why we weren't doing something. Thank you.
Thank you. Joanna and Ruth, and then back to Paul.
I wondered if it's possible to actually propose that we, as a scrutiny panel, put a recommendation to the Constitution Working Group that it takes forward, and we vote on it now, that we take forward a request that the corporate parents, I'm trying to think of the right words, that corporate parents is put within the Constitution in some form of words, and that all councillors are expected to attend one meeting per year, and that we vote on that now, that goes to the Constitution Working Group. So it's not just seen as a political Green Party issue, but a wider recommendation across the council.
So I'm just, so Kerry's just advising me that apparently this is not legally allowable, but there might be a way of making something so it's not necessarily mandated, but it is perhaps expected. Yes.
And we can, as a scrutiny, say that the Constitution panel have to come up with some kind of wording. That's what I'm looking for today from this group of people, from this committee.
Well, that fits in with what I've already asked the Cabinet member to do, but I'm very happy if you want to take a vote on whether or not you agree with that. Does everybody want to agree with that? We'll do it right now. So yes, everybody in favour of that? But an expectation can be put into it. Do you want to speak on this before we voted? Sorry, can we just...
Yeah, before we vote.
I apologise, I got a bit mixed up.
I mean, at the moment, as I understand it, the times of the meetings are not always the same, to allow people a bit of flexibility, isn't that correct? So in a way there is already encouragement, but I understand what you're saying. What I was just thinking about is the actual format. I missed that meeting, I'm afraid, because I was away, but I can imagine it would have been a bit, over-imposing, if you like, about consider the actual format of the meeting, or at least perhaps if you do have to have a formal part, then have it shorter and then have a, finish off and then have it more of a social with food involved, possibly, and in a different setting, possibly, or have additional, but that may not be so feasible, but have additional sort of social get-togethers which are very informal, just maybe with some kind of activity involved. And of course, again, you can't force people to come along. So, but if they're varied things, for example, I don't know, visit to a museum followed by tea and cake somewhere, something like that. Maybe you might. It would be another way of us getting to know the children, young adults.
Thank you, Ruth. Yes, I think there's many opportunities for a different way of doing this that need to be explored more. David.
Thank you, Chair. If we are going to have a vote on this, then we do need a slight bit of discussion on it. As a former paediatrician, I've held the child protection brief for Bristol on 1 rota, for instance, but I have not attended any of the corporate parenting days. And the main reason for that over the last year has actually been because of my health and because we're not working in a particularly COVID-safe environment that could have actually been to the detriment of my health.
Thank you, David. I think points around health always taken into account when we have any sort of statutory or mandatory or even an expectation. But I think the principle, I feel, is broadly agreed with about trying to do more to encourage more meaningful participation in corporate parenting and in our own sort of engagement in that as well. So perhaps having a vote is...
One of them was online. I think 2 of them have been online, and that has been changed. So it's not. So we can have ones that are online, and we can deal with health, and we have done that during COVID with council chamber issues. So there are ways forward on this. We have 4 meetings a year, and what we're expecting is that councillors attend 1 per year, and if one of them is online, then that should be in some ways possible for many people.
Do we... Absolutely. I think, yes, I absolutely agree with the sentiment that we do want to have greater attendance. We do want to have councillors really understand their role, and indeed senior leaders within council as well need to understand their role as corporate parents too. And I think perhaps we need to hear more what happens elsewhere, because not every council runs corporate parenting in the same way that we endeavour to do it here. So perhaps this is an issue that can come back to corporate parents, but if you can take away what has been expressed around how we can build in an expectation of at least 1 meeting a year attendance, I think that would be a way forward. Because I think, if there is no way of compelling councillors, perhaps a vote is a little is less useful. So if we can't compel councillors to attend, because
but that's not what I'm asking for this scrutiny at the moment. And my question is that we recommend the Constitution Working Group that they take forward some form of words to incorporate corporate parenting and to ensure that councillors undertake their duties in the way that we expect them to. And that's what I'm asking for us to vote on as a committee today.
Okay, I don't think that we can do that. Sorry, my apologies, because we have our duty is on recommendations to the executive, not to be the executive. So we can't, we don't have that power So I wonder whether or not Councillor May wants to respond to what's been asked to try and make there be a way forward on this.
I'm a bit confused, really, because I think there's a proposal that's come from the floor, hasn't been seconded. I mean, the leader of the council said that policy scrutiny committees should, in actual fact, have the opportunity to raise policy issues. And as I see it, that is the proposal. And I'm at a slight disadvantage because...
So, Kerry, could you just say what you've just said?
I think this point's already been raised with the monitoring officer, who's given a response in regarding that non-compliance of a councillor is not legally or constitutionally enforceable. So I think the point being made was that we, as a panel, this has already been taken forward as an outcome. So what I think the Chair was minded to do was encourage flexibility in terms of attendance at the meeting and opportunities to vary how it's...
But that's not what I'm saying. I'm saying that this committee proposes to the Constitution Working Group that some kind of wording is put in about corporate parenting. Not that we are deciding what that wording is. That Constitution Working Group actively takes forward a piece of policy work that ensures that some kind of wording is there, not what that wording would be. And that seems to be a decision you're making that is then informing us, and we are the elected body. So there seems to be a real problem here.
So what I suggest we do is, I think we're not going to get to a proper resolution right now, is we take this away and find a way forward on it, okay? Because I absolutely agree with you that there should be more councillors attending corporate parenting, but we do need to find something that is achievable. And it might be that
we're not able to put I can't put a vote today from this group to say that we recommend that. And that's what I'm recommending. I'm proposing that. No one will second me. If no one seconds me, then there is no vote.
So Paul and then David. David? So you were going to do the same. Or is any more discussion on this point? Ruth?
Sorry, just without having it here to look up, is there nothing already at all about corporate parents in the Constitution? I find that very strange, if there isn't anything in there at all already.
I don't think there is something that says about that we are all corporate parents, but I think the point around expectations and being able to compel councillors to attend meetings is not there because of the it's not legally enforceable. Okay. And we can also press group leaders as well to ensure that there is better attendance too. So shall we just move to the vote?
As I understand the law, there are no other sanctions that can be applied to a councillor. So we can't force a councillor to attend any particular meeting, but I think what Joe's asking for is that we encourage the working group to put it in and make people aware of it and their responsibility to it. So I don't have a problem with that idea.
I think that's very sensible, Councillor Crossley. I mean, like all of us here, I think there should be better attendance at corporate parents. But I think forcing people to attend is not within the remit of the Constitution. But I think if we're saying that, as you just said, Councillor Crossley, that there should be an emphasis on encouragement, especially through group leaders. But we can put that more forcefully than I'm saying it at the moment. And I think that would be a good way forward.
Okay, are we all satisfied now? And shall we move to the vote on this? All those in favour of the motion? Thank you. And all those against? And any abstentions? Okay, thank you. And obviously we do have members of the panel who do not vote because they are co-opted.
I would have preferred to have had the full, sentence or sentences read out loud, but the gist of it I'm happy with. But will we have that in writing? Or
Yes,
it'll be in the
of course.
minutes, won't
Yes,
it?
it'll be in the minutes. Right, okay, so we're going back to the Cabinet Members' report, and the next item on the knife crime awareness events. So do we have questions on this? I just have one question, which is, how do we measure the effectiveness of such events? How do we ensure that that this actually makes change? And I think Ruth had a question.
Well, it's more of an idea really, but which may or may not be feasible. However, I think it's great that these events are being organised for parents, carers and anyone over 16, I believe, is allowed to attend, about becoming more aware of the problems in knife crime. However, I was thinking, as well as doing that, is there any way, and I know it's difficult now because of all the schools pretty much being independent academies, but is there any way we can encourage schools to provide self-defense classes instead of some of their sports classes, PE? Because I think that would be very, that would provide them with practical skills, and I think that it would also encourage girls, in particular, but not only girls and boys, but it would also, perhaps they would need to be done separately, maybe not, but I think it would also, I would hope the take-up will be quite good. I don't know how the schools would do it, but I just think that would be very practical, rather than leaving it up to parents who can afford to pay for classes to send their children to there's a whole variety of different self-defense classes, aren't there? But something that would be kind of up to a point standardised, and then, for schools themselves to deliver. Because that would be something positive rather than... because that's why they... Obviously, it seems some young people feel that they need to carry knives with them to be safe, even though, in fact, it's going to have the opposite effect, but I think we need to offer them something positive. If we're saying don't take a knife, what are we offering them instead? So that was my idea, but I don't know how it's going to take it forward. Anyway.
Perhaps also it might be worth taking that idea and building it into the work of the knife crime panel as well, to see how effective, if that exists elsewhere in the country, to see whether or not that does make a difference in addressing knife crime, as well as perhaps before we put it directly to schools, but I don't know if that's something, I might be speaking a bit out of turn on that. Any other questions about knife crime? Onkar.
Thank you, Chair. So, in terms of awareness event, so how will we ensure that parents from across all communities, and particularly those in high-risk areas, are informed about and able to attend the event?
Thank you, Councillor. So just a couple of things on the knife crime awareness event. So this is the fifth one that we are running, and we will continue to run them throughout the year. So that's the most recent. We work with the schools to promote to all of the parents whose children are attending that school. So that's how we work to promote it across all of the areas. So we will continue to run those events. In terms of feedback, the feedback we've had from parents and professionals is that the nature of how the presentation is put together is very positive. And again, we would welcome open up to council as well in terms of attending. So we will continue to run that throughout the year. We have also had some positive news from the Office of Police and Crime Commissioner and that they have committed to continue funding some of the interventions that we've got across the local authority in terms of interventions directly to schools, and also with our Youth Connect Southwest, who operate some sessions for us as well. So that's positive. We do know from the Labour manifesto that there is additional resources referenced. We just don't quite know yet what that will look like. So certainly the youth hubs and other, there is a commitment about reducing or halving night crime over the period. So we're anticipating some additional funding coming through, our announcements about that come November. But we retain our violence coordinator, who works with schools in all of our settings and engaging with parents. We've got a new leaflet just about to be published, again for parents and carers, where they can source information and support. I think in terms of the question on the self-defence classes, we certainly could raise that with our school standards board, whether that's something that schools would be interested in developing. We could take that through and we could feedback at a future meeting. Thank you.
Very quickly, I think there's another 5 events that have been organised, and so really we're going around the area to try and make sure that we're doing that, and we work closely with the schools on that. Can I just ask, I threw out a challenge back to the committee, and I would welcome some update about, because the committee took on, if you like, a task and finished. Is there any idea when you're going to be coming out with a report on that at some stage? Because obviously that affects me and the officers, and I'd appreciate if you could give us some sort of idea about how that's going.
So I don't know if you saw on the minutes the last that were within this the notes of this meeting, but we did give an update previously. But obviously you will be aware that our work has we need to have waited to find out what the new government were going to do within within this area too, plus also the relatively recently elected Police and Crime Commissioner, and to see what her focus would be. But it is something that is very much on our agenda. I'm due to attend a policy meeting in the next, I think, the next few weeks. Yes, later this month too, and so our expectation is that we would have something to give to you. I would say before Christmas or around Christmas. Yes, this year, just to be clear. Okay. Right, let's carry on with the Cabinet Members' report. And just so you're aware, Eleanor, we'll actually take your statement after this item, which is a change to what I had originally announced, in view of the circumstances that you have highlighted. So we now move on to the DFE update. I don't know if there's anybody had any particular questions on that item. I think that was more of a we're waiting to see what happens next. Then the next item was school streets. I remember that when Andy Wake was in this room, we did also ask to be included in that work. I don't know whether or not. I believe Joanna was very interested in being involved. I don't know whether or not, Joanna, you have some questions to ask about school streets or any
well, I've not been involved in any way, and it would be useful to know which school is the pilot and which other schools have been interested, and how will the council be supporting that? Because essentially it's about the public highway and not about the schools, but they just happen to be delivered outside schools to make sure that schools and children attending them get there safely.
Paul?
I'll make sure that a reply is given to that specific question to the whole committee.
Okay, and also that point that we made about including this panel within that work, do you have any thoughts about why that appears not to have been taken up, or is that something we should you can investigate for us?
Well, the responsibility is another committee, as you know, but I asked the question what the current situation was, which is why I put it in there to make sure that I keep bringing it up. And I think, as I recall, that there's 4 schools that have actually indicated an interest in it. But I'll make sure that we send an email out to everybody just saying which ones.
Thank you, Paul. Okay, so Black History Month. Do we have any questions or comments for the Cabinet Member on this, Joanna?
I'd like to know what press releases have gone out on Black History Month so far this October. To date, I know from looking at Bain's press releases there hasn't been a single item that has gone out. There have been many other items that have gone out, but it seems like, you know, again, looking at our need to be inclusive as an organisation, that we aren't even able to do that as press releases. So I challenge that.
I don't know, Paul, if you've got a comment. I suspect this is more of a political direction in terms of communications.
Yes, thank you. I mean, I was just alerted to the question before the meeting. What I'll do is I'll talk to Andy Thomas, who's head of the PR, and we'll try and get something out on that. So it's a good question, and we'll deal with it as effectively as we can. I haven't got a direct answer at the moment.
Thank you. So the next item on your report was the Ofsted inspection of Adoption South West. I'm not seeing any questions that want to be raised on this. I just wanted to add that I attended a sort of inauguration, or it's not quite the right word, but the sort of a pre-meeting of Adoption South West as the scrutiny panel, as I'm going to be on that panel now. So Youth Justice...
Chair, can we just flag up that Mary has been chairing of that group, and she's now ended, but I think it's right and proper we actually say well done to her.
Absolutely, yes, well done to Mary. And I hope your successor is as good as you are. Kevin.
Only to note, Chair, congratulations on the inspection outcomes.
Thank you. Yes, I'm sure we all echo that. So the next, another inspection is the Youth Justice inspection. I don't know if there's any questions anyone has on that. Onkar.
Thank you, Chair. So, Youth Justice Service inspection. So what key improvements or challenges are expected from the upcoming inspection? Thank you.
Thank you. It's actually been a number of years since we've had a youth justice inspection, and we are one of the last 2 authorities in the South West that will be inspected under the current framework. So we were notified 4 weeks ago of the inspection, so the team have been quite busy getting all of the submission documents required, as well as the case studies. So the inspectors will have four inspectors from probation will be on site from the 21st to the 25th of October. They'll be based in the Civic Centre in Kensington. And what they will do is they'll look at the effectiveness of the multi-agency youth justice team in terms of responding to, recognising and supporting children at risk of offending and those who have offended. There will also be a scrutiny around the multi-agency youth justice board in terms of how effective that board is in terms of supporting the service around interventions. So I've been working very closely with Carla Cooper, who's our interim head of service, and our meeting later today is to look at the presentation. So one of the things that we will do, Councillor May will be part of that set-up meeting as well with the inspectors when they come on site on the 21st. We'll give an overview around how our performance is. And the Youth Justice Service delivers very positive interventions. So we would be expecting a good outcome in terms of the inspection. So they'll scrutinise, they'll meet with young people. So one of the other things we've had to do is to send questionnaires to all of the young people and the parents of who are known to the service. So the inspectors will meet with those young people and they'll hear from the young people their experience around how well they've been supported, have the support they've received been effective in reducing their offending. So we'll get some verbal feedback, and we will, of course, share the report with panel when that report is made available to us. Thank you.
Thank you, Mary. Paul, did you want to add something?
Yes, I could. Just a reminder that the annual report and the forward plan was approved unanimously at the Council, which is an important issue from our point of view. And there were a number of issues quite clearly picked up in that forward plan about the partnership working and how effective that is, but it's also how we deal with pre and post court work for young people, being child focused, that we actually then identified the two areas where the major issues were. One was around inclusivity, is that the right word? And the other is around SEND, where we've got higher numbers, but overall the issue in this area is actually still low, and the risk to the community is still low. And I think that it's important that we actually do register that, because I think it is something that we've got to deal with and hopefully get those messages over effectively to the inspectors.
Okay. What else? Regional Fostering Southwest Hub. Any comments on this item? No. Then the Health and Wellbeing Board. Thank you, Leslie, for attending that. I think we should all take a note, and we should be led by your example and try and also attend where we can. So I think it's a very interesting board, and it will be useful for us to give us insights as well. Joanna?
I believe we did ask for the dates of those meetings to be put into the scrutiny committee's diary, so that we then can know when they are and to make sure we do attend them. I'm not aware of that happening.
I don't believe that has happened either. I will pass that to Mark to make a note of and to action. Children with complex needs. Any points on this? Okay. Right. In that case, then, I think that item is has been fully discussed and debated and questioned. And so does anybody want to have an official break, or do you want to just press on? Which one are you saying yes to an official break, Joe? All right, so 5 minutes. before we carry on with the rest of our agenda.
Thank you very much, Madam Chairman. I thought of calling this speech "The View from the Wheelchair," because although there have been a number of concerns to me in your papers, it is the attitude which underlines questions of disabled access and disability rights, as evidenced, for example, in a recent planning application, which need to be addressed. Consent was given for a block of 77 co-living studio flats designed for young professionals. There will be 77 bicycle stands in the Undercroft, but only 5 car parking spaces, only one reserved for disabled people. The assumption would seem to be that those with mobility problems are not young professionals. 3 of the flats or units could be adapted for wheelchair users, we were told. Not all the 5 floors have got community kitchens either, so that would necessitate carrying meals up and down the stairs. Probably all councillors have encountered the situation where a housing association takes 6 months to make appropriate adaptations for incoming disabled students, and then, when that tenant leaves, has stripped out the property, a huge waste of time and money, while the home search register grows ever longer. There are areas of the council estate where either a wheelchair cannot move or there is no evacuation provision for the disabled in the event of fire. And this even applies to the new council offices in Keynsham, a modern building. The problem is that rights for the disabled are tacked on at the end of reports or, as in the case of planning applications, not considered at all. So the report on school exclusions does not tell us how many of those excluded have a disability, such as severe dyslexia or autism. We do not know, apparently, how many girls were pregnant and were excluded. But more worryingly, given the national statistics, we are not told how many children were withdrawn from school by their parents because their needs were not being addressed. So often it is just merely a case of good practice. I was the faculty office for disabilities. I was the faculty officer, felt like being an office, for disabilities at the University of Derby, and I changed my teaching methods altogether to assist the high number of profoundly deaf students. The other students complained, so I treated them all the same and gave them all the same handouts, the same opportunities and so on. A level playing field should be really level, both for disabled and not disabled. It would also be good to know from the reports how many disabled students are survivors of abuse. The trouble is, with my own problems, I cannot read all the safeguarding reports that are in these papers, and I consider the whole question very important, but I fear that the figures that I have managed to understand are an underestimate. So where does that leave us? Firstly, I would like to know the answers to the questions that Councillor Wright in the minutes of the previous meeting, Councillor Wright asked Councillor May a number of questions he couldn't answer, and I'd be grateful to have those answers when they're available. I am concerned about the remarks about housing. I have already touched on the importance of having suitable housing available for those in need, especially wheelchair users. I am sure you are aware of the health implications for people in unsuitable and often expensive housing, so I hope you wouldn't rule out considering questions of housing in the future. Secondly, an action for you, could you please remind the planning department of their obligations to disabled clients? What I can tell you from personal experience is that living with disability is difficult enough on its own. One does not need additional bureaucratic struggles or even denial of access. But that's a general comment and not a criticism of officers. Because obviously there's basically good sound work in these reports. It's just unfortunate that I have become a rather more subdued character of late and didn't challenge the notice that was on the door, excluding people from your meeting. Anyway, finally, I hope we're going to, as a sort of postscript to the Knife Crime Working Party comments on it, I hope we're going to see an action plan very shortly. But thank you for your attention, and I hope you'll take it to heart, if I might say so.
Thank you very much, Eleanor. My apologies again for the misleading notice on the door. Obviously, we would have been delighted to have seen you sooner. Can I just ask a quick question, and then I'll open this up to the floor for any factual questions. Are you planning to take this statement to the Climate Emergency Scrutiny Panel that also, as I'm sure you're aware, looks at housing? If not, we can ask for this to be forwarded to them.
Well, it's a bit like corporate parenting. I find that the actual date of the meetings is often not one that I can manage, but I think that's a very good idea. Yes, thank you, Chair.
Thank you, and I hope that they will then feel that they should be passing the statement on to Matt McCabe, the Cabinet Member for Housing as well, to ensure that the points you've made are put into the local plan and into planning policy. Any other comments from the panel?
I was just going to reiterate just what you said. Eleanor, many of the points are to do with planning and planning applications and being mindful of the implications for wheelchair users and disabled users when planning applications are put through. Is there not a way that this could be put forward to the head of planning and the planning committee to make sure that this is considered when they're looking at applications?
As in the case that I cited of the 77 co-living units, it was the planning committee who raised the question, who said, you know, this isn't any good. It was they who raised it. And I do sort of, dare I say it, think that perhaps a little bit of the bicycle space ought to be sacrificed for a couple more disabled spaces, given that there is supposed to be 3 flats that are wheelchair accessible. They each ought to have a space assigned to them. But, yeah, that...
Well, sorry, Liz.
So surely there must be some sort of equality impact assessment that would bring this into consideration.
It usually is, and it usually does in the officer's report as opposed to the actual application as it comes in, but it usually doesn't tell you anything.
I think that is clearly a point that needs to be addressed in the planning committee, and obviously, as you know, as a PDS panel, we can't really comment on, and ought not to comment really on individual planning applications as well. But I think the points you've raised are certainly of interest, and I think, as well as speaking to Matt McCabe and Andy Waite, maybe you could raise this directly with Ian Housel, who is the chair of the planning committee. Joanna.
Thank you for your statement, Councillor. There was a response sent to us, I think it was on Friday, in terms of your questions about ECHPs. So one of the questions we asked was how many ECHPs within Baines are not issued within the statutory timescale of 20 weeks after the decision is taken to carry out a needs assessment. And the response from Councillor May was this calendar year, 25.1% of plans have been issued on time. So you and I can do the maths, I think you better than I, of it's approximately 3/4 are not done on time, which is a significant issue that probably has long-term implications both for staff and for families and particularly for children. I brought this up at the beginning of the meeting, and I have asked that this can be on the work plan in some form. So I'm looking at the chair.
Well, I was just checking whether or not we had EHCPs as an item that was going to return to this panel, and I think it's kind of like on our tentative list, but I think we might be able to push it up because this has come up on a number of occasions. So perhaps we could think about this for maybe November. I'm not thinking that was slightly out of the top of my head, though. So we'll certainly push it up and re-look at EHCPs, particularly about their timeliness.
I guess following on from that, my question to you would be, Councillor, the deadline numbers are awful, so this must be costing the council a huge amount of money, and I just wonder if you know about any action, legal action that parents have taken because of these bad outcomes.
I'm afraid I don't, Chair, and it's always difficulty when you're a ward councillor, when a resident comes and says, I haven't got this, and I've got a situation of a resident with very complicated, complex needs whose annual review was delayed. I mean, he's been in the system for a long time, but you don't know if a situation where somebody's fallen through the cracks is an exception, or if, as I think there may very well be because of the shortage of staff in the council, there's a general problem which this committee should be looking at.
Thank you. I think we'll take on board those comments. And I need to just correct myself. It's not the November meeting, it will be the December meeting anyway. But we will certainly take this all up within our agenda setting meetings. And but as I suggested before, I think your statement would be very pertinent to the work that first of all, the other scrutiny panels are doing, particularly the one chaired by Andy Waite that looks at housing. And we can certainly forward it to him if you're not able to attend it. Eleanor, last question.
Very kind of you, but it's not just the actual hard cases, it's the attitude to disabled people and disability rights that I would hope we would see changing in the council.
That point is, I think, very much accepted and I think agreed with, in this, certainly in this panel. Okay, so, sorry, I've got all sorts of things coming from my screen which are a bit unexpected. So, thank you, Eleanor, for your statement. Thank you for your patience until we got to this point where you could make your statement. And I hope you are somewhat satisfied with our response to it. Leslie.
Sorry, could I just ask a factual question, Chair?
Yes, sorry, did you, had you indicated before? Sorry, if I missed you.
No, I didn't. It's just, it occurred to me as we just had that last answer, so I'd just like to ask Councillor Jackson if you think it would be a good move for this council to formally adopt the social model of disability in respect of trying to ensure that there is better access for disabled people. Thank you.
Yes, I think that's a very good idea, but I would also like the fire safety review to be carried out on the Keynsham Council buildings, because we had fire evacuations and there was no means of getting my resident out of the building.
Thank you for that last point as well. I think we will need to pass that to an appropriate officer for their action. So I will leave that to my colleagues to determine that person. Thank you, Eleanor. Okay, so we now move on to the Baines, Swindon and Wiltshire Integrated Care Board update. And thank you, Laura, for saying that we can just move straight into asking any questions. So do we have any questions? Councillor Crossley, Paul.
It's gone off. I do remember what it was about. It was in the bit on Stoptober. So I've lost it. It's gone from, I think, I can't get it back quick. We've got an increase in vaping, and as far as I'm concerned, as a layperson that doesn't smoke, vaping has all the same problems that smoking has, but perhaps a little bit less. And Stoptober seems to be all about tobacco smoking. Is there any plans to bring vaping into the same sort of disrepute that smoking is, or the same sort of challenge that smokers have?
Thank you, Councillor Crossley. So we've actually had this discussion quite a bit at the Health and Wellbeing Board. I think in the context of trying to stop smoking, there's recognition that vaping can sometimes assist with that. But of course, we do know that there are significant issues around vaping itself, and indeed the Health and Wellbeing Board decided to write and make that recommendation that we should also be focusing on vaping. If you note in the report, what we actually go on to talk about is that when we are talking about our stop smoking support services, they do actually also include vaping advice services as well. So they are currently provided through our community provider at this moment in time. So that campaign that we're doing around Stoptober, which is through social media and press releases, does actually refer to that stop smoking support and vaping advice services. So that's how we would be dealing with that, noting your very valid concerns there. I realise I haven't numbered the paragraphs, so just on the second page, I think, third page, forgive me, of the report, and it's about the third paragraph down. Apologies, it's difficult to navigate it. So the ICB has supported the campaign through publicity, its social media channels and press releases, and signposted local people to the HCRG Stop Smoking Support and Vaping Advice Service.
So top of page 34. Lovely. Okay, so I've got Kevin and, in fact, pretty much everybody. So, so you can start, Kevin, but remember there's people to follow.
Sorry, put the microphone on. Two particular areas, one around maternity and pre and postnatal support. Just wonder if there are any metrics to support the good work that seems to be going on in this area that you can show us on how things are moving forward and how Baines is doing compared with ICB and sort of national, because you seem to be doing some good things here. Second area around suicide prevention work. You had place level and policy, I think. Just at the place level of Baines, a bit more about who may oversee it at the moment and who coordinates it, and particularly around the early intervention and prevention work, and maybe how schools are involved in that work that you're doing. And finally, not quite actually mentioned in your report, but something was raised, I think, last time around pharmacies, and it was interesting that shortly after the meeting there was a national piece on radio about pharmacies having no resources, no staff, and what are you doing? And particularly on pharmacies about, as more and more people, if that's your intention, are using them, how is that joined up line of technology and information going between GPs and these other satellite points of contact that people may be having, so that GPs can hopefully join the dots if somebody's going to several external points and realise this person may have a bigger problem than they actually is letting on.
Thank you for those points. If I may, I might take them in reverse order. So the pharmacies work, I think it would be helpful if the panel are in agreement and through the chair to bring that back to a future update. But you're quite right. It's making sure that we understand, if we are looking to fully utilise and look at exploring how we can use our pharmacists more, what's the linkage then, and what infrastructure do we need to have in place to make sure that primary care and every point of access follows that person through the system. So if that's agreeable, we'll put that in a future item update. On the suicide prevention work, I should say that at your next meeting, I understand you will have public health colleagues alongside ourselves that will come along and do a more in-depth report on that. So this is just a headline, really, a timely headline, I hope. In terms of who will oversee the work, we have taken this to the BSW Suicide Prevention Group, so they formally will be overseeing the actions of the work. When this was reported through our BSW channels, we all felt very strongly that this should go to each locality and that we should obviously be raising awareness, but also seeking more buy-in, because this is not going to be in the gift of any one organisation. So to that end, we have already taken the report through our Integrated Care Alliance in Baines, and we've made a commitment to take it through each Integrated Care Alliance, so also Swindon and Wiltshire. I believe it will also be coming back through health and wellbeing boards as well. And I think the key thing we need to understand is how are we going to take those local actions forward, and who's going to be responsible for each of them. So even though the BSW Suicide Prevention Group may well have oversight, we need to make sure that we've got ownership of each of those actions. And you'll also note in the report that there is rightly actions for the system as well. So we'll be taking those through both our Thrive Board and our Population Health Board. So there's definitely that read across there. And then if I may, just on the maternity update, I think the short answer is yes, we do have data. We have a dashboard that we do look at. So I might suggest that we take that offline and I see if I can provide some suitable information to provide an update. And I'm noting that you're asking for benchmarking across other ICBs. I think one thing perhaps just to draw out and flag, and this may have been the bit of the report that you were referring to, but in particular I think it had been recognised that the work particularly of Ocean, which is our support, mental health support, I think we could see through the evaluation that there was a definite difference in the trauma scores of those that had accessed Ocean versus those that hadn't had that direct support. So I'll see if I can get some further evidence to support that and explain that a bit more.
Thank you.
Thank you, Laura. Paul, did you want to come in? No, sorry, not you, Paul, that Paul.
Sorry, Paul. It's too many Pauls. Just to flag up that Rebecca Reynolds is organising an event, a professionals event around suicide. And I was just looking through my diary, seeing if I could find it, but I can't find the date. But there is a Baines initiative going on. I went to the one last year and it was really quite scary because the number of suicides in this area is really, we're an outlier in Baines. So it is an issue, and the South West, it is a major issue. So hopefully, I assume that Becky will be reporting that at a later meeting, Chair.
As Laura said, we are expecting the suicide prevention report to come to our meeting in November. So hopefully Becky will be able to update us on the event, plus any other comments on being an outlier too. So thank you, Paul, for raising that. And Paul, I've put you back on my list, but not yet. So Liz.
Thank you, Chair. It's really good to see a maternal mental health, the mental health services called Ocean in place, but when I went to the website, the waiting time is between 4 and 6 months, and surely for women suffering trauma of some sort, it's quite a long wait. So would you like to comment on that? And then, I know you've talked about coming back with us with updates, but we've heard nationally that there's a general shortage of midwives, and locally, anecdotally, I've heard that there is a shortage of midwives. So, you know, how as we're talking about maternity services, how well are they being supported in our area?
Yeah, thank you for those questions. And again, just starting with the last point around the shortage of midwives. As you know, we are looking at workforce planning across the system, and this is a known shortage, and I think nationally, not an exception in BSW, if you like. So we are working across our system with our workforce colleagues to try and understand what we might be able to do to encourage and secure more resource in that space. And if it would be helpful, I can ask our workforce leads to give an update on that specific piece of work. So there is a broader workforce piece of work, but specifically targeting midwives. Sorry, Chair, it looked like you wanted to come in.
The other one was the Ocean website.
Yes.
The waiting time was between 4 and 6 months, and I thought that was quite a long time if you're needing help.
Yeah, again, that is one that I'll need to take away and get clarification. My understanding is that the way we look at things at the moment is to understand need. So once that need has been identified, then the appropriate pathway of whatever support is most appropriate is then the support that's provided. So I'm not sure if it is a blanket 4 to 6 month waiting list, but if it would be okay, I'll go away and just get under the skin of that and understand a bit more.
That would be really useful, Laura. And just one very quick question, and it's good to hear that our suicide prevention strategy will be brought back to us at our next meeting. And nationally, there's a strong link between areas of deprivation and suicides. And I just wondered if at all possible that this would be included in the work that we get. And please, I'm a bit ignorant here. What do you mean by localities? How local are we drilling down into? Are we talking about wards or areas around GP practices, or what are we talking about?
So in that context, when I talked about localities, I was just referring to Baines, Swindon and Wiltshire as localities, but you're quite right. When we're looking at the strategy itself, and part of the reason that the Population Health Management Board are looking at this, we have to look at population health data. And as Councillor May was alluding to, we know that we do have some variations in our data in Baines and more significant prevalence of certain groups, ages, and indeed a gender difference as well. So that is absolutely the granularity that things need to be looked at. And I should also say that public health colleagues, and Paul Scott has actually led the work and has done a tremendous job on behalf of the system. So I'm sure that speaking with Becky and Paul, we can make sure that we include that in the update next month.
So as I said, I have got quite a long list. Leslie.
Yes, thank you for the report. I have to say that it's much improved from what we first used to get, which was a verbal update, and then we got a slightly longer written one, but so that it's much better to have got a lot more detail for this one, so thank you for that. The only thing is we're getting a lot of information about initiatives, which are great. I'm not saying we shouldn't have those at all, but I'm a bit concerned. It's quite difficult for us to actually scrutinise an initiative. What we need to see is a little bit more about the sorts of trends regarding health that are coming out of this for the area, and looking at those kind of issues that we can actually review rather than just look at an action, which I'm not saying that they're wrong, I'm just saying it's we need to be able to scrutinise it. I wanted to pick up on physiotherapy. We discussed this, I think it was back in July, and I think we were quite agreed as a committee as to the information that we required. So it's a bit disappointing to just get this statement at the end to say you want to work with us. Well, that's great. But would like to see those figures so we can start scrutinising that particular service. Thank you.
Thank you. Laura, would you like to respond?
Yeah, I think it's fair to say that on the physiotherapy services that we would probably just need to understand, and perhaps I can remind ourselves by looking back at the July notes, specifically what update you required, the type of information and data, if you like, that we capture is obviously something that we would monitor through contract performance meetings. So there is a wealth of information, but it's just trying to understand specifically what it is that the committee would like to look at and understand, as opposed to those contract performance management meetings, which are a function of council officers and ICB officers. So I think it was just that distinction, really. And it's a high volume service that's provided in many different ways. So again, there's different aspects, I guess, of physiotherapy. So it's just trying to understand that. But of course, we will work with you to make sure that we get you an update that is meaningful to you. And likewise, just noting your other comments, Councillor, on the report and how it would be helpful to have a balance. Yes, hearing about initiatives, but certainly wanting to understand a bit more about trends, and I'll take that away and be mindful of that in future updates.
Thank you, Laura. So I've now got Ruth and David, you're on my list as well.
Thank you. Mine is just going back to the Stop October campaign, and found that wording and what was it? And so it's about providing information about quitting smoking with a vape. So vapes are considered less harmful than smoking, but ultimately you don't want to be addicted to vapes either.
Correct.
But I was going to say the emphasis is always on the multi-use ones rather than the disposable ones, isn't it? Because, and this is probably something for the other scrutiny panel, the Climate Emergency and Sustainability PDS panel, but, you know, it is an ongoing problem, the amount of waste, apart from the health aspect, the amount of waste that we find on our streets. And I don't know what we can do to try and maybe to reduce that, but that perhaps that's not your concern particularly. But I just wanted to be reassured that you always encourage people to use the reusable vapes, and that it's not, you know, that at some point they should be aiming to give that up as well.
Yes, absolutely. And again, just to reiterate, the Health and Wellbeing Board, the angle that they were taking was particularly a focus on campaigning not to have the single-use vapes, and also aiming at children, because as we know, typically the single-use vapes are cheaper, they're brighter coloured, they're often packaged and put in shops next to things that would catch the eye of children. So yes, on all counts.
Sorry, this call. Thank you.
Sorry, Chair. It's been referred to the Health and Wellbeing Board a couple of times. I chair the Health and Wellbeing Board, and it covers adults and children. And we had a full report from the health team about this, and I think Councillor Malloy was present when that was discussed. So it is something that is really important and has been taken up by the Health and Wellbeing Board. And I'll try and make sure, talking to Laura in the future, we will do a follow-up as soon as we can on that, because it is a major issue in terms of the health of the population.
Thank you, Paul, for the assurance there. David, you're on my list. Is it something you need to come in right now? Because you're pushing in front of Barrett. Okay, so
I just wanted to mirror what my colleague Ruth has said about vaping, but in particular, really our emphasis ought to be do not take it up. Because the problem is, once you've taken it up, it is very difficult to give it up. It's highly addictive, and our strategy should be around how do we inform, advise, educate, and encourage you never to take it up.
Absolutely, I couldn't agree more. And campaigns with schools is obviously part of that. But again, just all of the advice services and the general health and wellbeing services, that would be the spot-on advice, absolutely.
Thank you. And from one doctor to another, David?
Thank you, Chair. Laura, with respect to prevention of birth trauma, in addition to the recruitment, retention and sickness problems you have in maternity, there's the delivery of midwifery continuity of care process, the need to deliver one-to-one care during labour and two-to-one care with home births. So are these being delivered within our hospitals? Are there hospitals even funded in terms of their establishment to deliver that? And similarly with the neonatal units, one-to-one nursing, for instance, is required in ICU, etc. There are national framework for that as well. So the same question really is how far below the actual demand is the funded establishment?
Thank you for that question. I don't have the specific answer, but I can take that away and bring that back. What I can say is obviously there is a commitment around the safer staffing levels that all hospitals are working towards. Also in the report, you'll note that we do encourage the personalised care plans where they are appropriate as well, and that's for the whole pregnancy journey for individuals. So if I take away your specific point, I think those personalised care plans and also the work that we do with our maternity teams probably cover off the other angle of your question.
Sorry, so you will be coming back with a more detailed answer?
I can come back with the detailed answer, and I think you're saying how much do we know if they're at full establishment in each of our acute hospitals, and is there one-to-one? Nursing.
Well, does the funded establishment meet the activity that they're supposed to deliver?
Okay, yeah. So an additional question. So not are they only at full establishment, but does the funding establishment meet the standard?
Absolutely.
Yes.
Big
Understood.
difference.
Understood. Thank you for that clarification.
If I may also ask about a little bit more data and metrics on the cancer pathways and trends, as we've heard from Councillor Mansell, etc. It'd be nice to see a bit more data over, say, a 5-year time period, because clearly presentation and the way in which you might present to the service might be different from gynecology to ENT to gastroenterology. So different services may have different bottlenecks or different shortages or whatever that create a problem. So whether it be delayed to initial appointment or diagnosis because of biopsy or scan, or delay to treatment. So if we could see a bit of data across a number of the services, that would be great. Thank you.
So the data that we do capture is around the 28-day standard and the 62-day standard. So if it would be helpful for the panel, I could bring back the dashboards that we do for our elective recovery board, and I think that would contain the information that you're looking for.
Thank you.
Thank you. So I've got Paul, then Joanna, then Onkar, and then I've got a last question unless anybody else asks it. So Paul.
Thank you very much. Yeah, I've remembered my question there. It's to do with, I've got the page up in front of me now, sorry, I've got the thing back. Again, it's about vaping again, which is the point that Bharat raised. The thing that concerns me is that I have no problem in a strategy that takes people from a very dangerous addiction to a less dangerous addiction. My concern is that all those people that are starting vaping who didn't smoke, and the addiction that we're getting through vaping. I have a real problem with the whole concept of vaping. I think it is going to prove in time to be nearly as dangerous as smoking is, particularly if we give the impression that it's safer, in quotes, however we do that. So what I would like to know is, in Stoptober, my question, perhaps I phrased it wrongly before, are we going to include vaping in Stoptober in the future?
So I think we include it now. Well, I think what we do is, that is true, so it is looking at vaping as a less worse alternative to smoking, you're correct, but there is also vaping advice services, which, to the point that was raised earlier, is about prevention in the first instance and avoidance. So obviously that in the first instance it's absolutely prevention and avoidance that we would want to promote. But I hear what you're saying. Your concern is, should it be stop vaping as well as stop smoking, full stop, in future campaigns?
Yeah. Do we have figures of people that are going straight to vaping and bypassing smoking? Do you have that sort of detail in your research?
I would have to work with public health colleagues because these are services that were commissioned jointly, but I'm sure that we can have a look at that and bring that back.
And as Becky, we hope, is going to be at the meeting in November, then perhaps you'll be able to add something in her.
I can link in with Becky before then, Chair, yeah.
Joanna.
Thank you. Yeah, I'll just back up Councillor Crossley on that. Yeah, I mean, the messaging that is given over about smoking and vaping is that vaping is a way to help you stop smoking and it's better for you. And that's what the average person thinks, so they don't think they're doing anything wrong with themselves. It's the wrong messaging. And again, my question is about messaging. You said that there's an awareness campaign for cancer for residents in Bath and North East Somerset. As a resident of Bath and North East Somerset, I haven't seen anything. So if I haven't been reached, how is anybody else being reached?
Yeah, the point is noted, and I can certainly have a look at what channels we're doing that through. Members might remember that we spoke about this last time, so there are several different campaigns actually that might target different cancers, but in particular there's one called Check Yourself Out, which is generally asking people to just have a level of self-awareness around some of the more common symptoms, to see GPs early, to access support early, and again that plays into the update that I brought to you today around obviously trying to get early identification, because we know that that increases people's outcomes and chances, and in particular the 28-day wait.
Thank you, Laura. Onkar.
Thank you, Chair. So I got a couple of questions in terms of public health initiative. So the first is, how will the success of Wellbeing's initiative be measured, and what specific health metrics are being tracked to assess its impact?
Sorry, Councillor, thank you for that question. I'm just trying to navigate myself into the report. Did you say the Eat Well campaign?
Be Well.
Oh, the Be Well campaign. Yeah. Forgive me. Again, I can link in with public health colleagues on this one, but this is a broader health and wellbeing campaign identifying what factors for healthy living are. And again, this is trying to focus on that prevention and avoidance strand of our shared strategies, because by raising awareness and helping people understand what healthy lifestyle choices there may be, then we can obviously try to address issues before they arise, so either prevent or avoid them. In terms of the metrics, there are a number of different ways that we capture that. So again, I think some of this is reported through the Health and Wellbeing Board in our public health updates, but it might be sensible if we look at what type of information might be helpful for this panel so that you get an overview of that. So I can take that back to Becky again, and we can work through that together if that would be helpful.
Thank you. And so in terms of metrics, so I was about like a health metrics. So what sort of health metrics are just for your
the ultimate one, but obviously it takes a lot longer to measure, is obviously the life expectancy. What we're trying to do is narrow the gap, and also the number of healthy years of life expectancy. But clearly they're much further into the future, and we have a number of other metrics clearly that we need to look at to make sure that we're staging ourselves.
Thank you. And my second question, in terms of social prescribing, how will we ensure that social prescribing services reach the most vulnerable population, especially those in rural or underserved areas? Thank you.
Yeah, that's a really helpful question. Thank you. So social prescribing is quite a broad term, and it can cover a range of different activities. We've got a number of initiatives that are happening at the moment, and actually some dedicated specialist resource. So, for example, we have a social prescribing manager who is working with 3SG, the Third Sector Alliance, and also the council officers and the ICB, predominantly to help us map and understand what our social prescribing activity looks like, and then thinking about what does access to that look like for our residents and for our communities. So to speak directly to your point, how do we target those areas that might be most in need, whether they're our rural communities or others, and how do we try and match them, for want of a better word, to some of those activities? So our sense is that in Baines, it's not that we have a lack of social prescribing activities to refer people into, but that we need to get that match right. So again, that could be something that the panel might like to look at on a future agenda item, if that would be helpful, or indeed outside of the meeting, I can provide you with more of an update if that would be better.
Thank you, Laura. I am seeing Ruth's hand. Okay, Ruth?
It's just a suggestion. Could all the members of this panel be sent sort of automatically invitations to the Health and Wellbeing Board meetings? Not in the expectation that we all come every time, but that we're aware of them and then some of us will come sometimes.
I think we gave that as a task to Mark earlier in this meeting. Yes, we did. Yes. But thank you for reiterating how useful it would be. So, interestingly, during that discussion on vaping, I received an email from Cancer Research about additional funding that had been received by many councils and about what difference such funding had made. So what I might do, Laura, is I might pass this to you for your response rather than trying to paraphrase the email right here and now. But what I actually wanted to ask you about was the £35 million contract, the community contract. So, and just wondered if we could have an update on that. I thought we were due to hear something about that during October.
Sorry, Chair, just to clarify, do you mean the integrated community-based care?
I do exactly mean that, yes.
Chair, forgive me, I'm not able to provide an update to you on that today. There will be one in due course, I understand, but unfortunately I don't have any update for the panel today.
How long is due course? Do you know, roughly?
I'm afraid I don't. Sorry, Chair. As soon as that is available, obviously, we'll make sure that all panel members get that.
Thank you very much. Okay, I think we have covered this item sufficiently, so thank you very much, Laura, for your helpful responses to our wide-ranging questions. And then we now move on to the Community Safety and Safeguarding Partnership Annual Report. I think, Paul May, that is, you're going to introduce this item, and I think Mary then might be available to fill us in any details.
Thank you, Chair. It's an independent board and it's chaired by Fiona Field, but Fiona can't be here today. It has been submitted to and I think approved by the Health and Wellbeing Board, so it's mainly here today to be noted in terms of the presentation, and Mary has volunteered to do the presentation. But we are obviously, like any other annual report, it's for us to note any issues that are arising, and we would then deal with them effectively through the panel, through the partnership board.
Thank you. I don't know, Mary, if you wanted if there's anything you wanted to add to this report rather than present the whole report.
Yeah, thank you, Chair. I guess to add, there's a small number of slides that Fiona has that have been shared around. There's obviously been some changes to the partnership structure in the last year, and we've reverted to 3 assurance groups: safeguarding children, safeguarding adults, and community safety. And the feedback that we've had since we've moved to that arrangement that feels is providing better assurance. I chair the Safeguarding Children's Assurance, and in that manner we now receive reports from all of the subgroups that are supporting children and young people. So I think that changes to the structure has been welcomed. Colleagues may remember we had the LGA do a review of the Safeguarding Board arrangements back in 2023, so these are now the revised governance arrangements from that. There is a particular slide that outlines all of the learning and practice, because again, from all of our safeguarding is about learning from what is happening both for children and adults. And there's a slide that does indicate there's been a number of safeguarding practice reviews as well as an adult safeguarding review. There have been no domestic homicide reviews in the last 12 months, and that has been confirmed by police colleagues. Slide 5 gives an overview around what has happened as a result of, because the whole principle is what do we learn from and how do we improve our multi-agency practice. There's a slide then around training and development. I think what's critical on this slide is that the board has now appointed a trainer, which I think will really help with compliance with, in terms of the training standards and figures. I know last year when this report was presented there was some concern around the training figures, and again I'd be happy to take any questions on that fact. And then the commitments for 24-25, we have an annual development day with all of the board, and again we look at what are the presenting issues for us across Bath and North East Somerset and what are the areas we need to focus on for the following 12 months. So those are there in terms of the commitments. The board has also appointed an independent scrutineer. So one of the requirements of working together 2023, and also some changes made around safeguarding children, that we need to have an independent scrutineer, and he has started in post. His name is Chris Robson, and one of the key actions he's been asked to undertake is to provide assurance to the Safeguarding Partnership that we're compliant with the changes that have come in. So two of those changes is that the annual report has to be shared with the National Safeguarding Panel, and that's a new requirement this year, and that the annual safeguarding report should be completed in September. So we're compliant with that, but we'll be further assessing our compliance in terms of working together 23. Happy to take any questions or comments back to Fiona, or indeed to any of the safeguarding assurance groups. Thank you,
Thank
Chair.
you very much, Mary. Questions, I've got Kevin and then Liz.
Thank you, Chair. I suppose the first question, Mary, is really how does the BCSSP know it's successful? I read an awful lot of information. I read an awful lot of people and subcommittees giving good comments about what they were doing. But there was nothing specific saying, this is what we intend to do, this is how far we've come, this is what we still need to do. And it just looked like a lot of good things, possibly, we hope, are happening, and things being said. But there was no specific thing to say, well, on page 22, I can analyse that your target was X, and actually, you've only reached Y. T. What are you doing to get to X, if you see what I mean? So that was the first general comment about the sort of performance. The second bit was around the audits section. Who completes the Section 11 audits? Some organisations say they gave limited or no evidence of application impact, so what's been done about that? One school didn't respond to an audit tool. What happened there, and should they have done, and what went wrong? And the safeguarding audit said 18 were completed and received. Well, how many should you have received? If you sort of mean, there's just sort of things that are said, but there's no benchmark or anything to go against it to say, so what? Then in the training section, training was identified as, why are people not attending the courses? Is the training being identified in the right way? And is it mandatory? And if it is, then surely everybody should be attending them, should cancel. And why are courses being cancelled? You talked through on the purpose of the target column. I couldn't understand why, if the courses are relevant, there's a target of 80%. If it's a relevant course, surely everybody should be taking it. And then the worrying thing, of course, was when you look at the grid of the RAG rating, isn't that a worrying picture? If people are supposed to be taking relevant courses and didn't seem to be achieved. And then, of course, the last bit was around the risks and things that were posed around the police reports for the very vulnerable children. there's some specific questions, I suppose, around page 75. Why is there a risk for 16 people remaining when it seems that outcomes were closed or that the situation finished? If you're striving for 100% of discussions with 4 days of concern raised, still only 57, what's been done to meet the 100? So there were a lot of questions raised, but nothing actually pinning down on what's happening and that we could then ask, so is that a good move or what, you haven't done anything about it?
We'll attempt to answer some of those questions. So if I can take, I guess what I'm hearing is that the format of the report and the lack of benchmarking year on year is making it difficult to come to a view about whether the performance is where it needs to be. So I can certainly take that back to our independent chair in terms of the format to give some further assurance in terms of some of that. The targets are targets that have been set nationally. Those are national targets. I think the report does articulate that in not having our own trainer, that perhaps did impact in terms of some of the performance. But again, I can take that away. In terms of the Section 11, so I would have to go specifically about which one school didn't take part, but generally we've got very good engagement from all of our schools around the Section 11 audits, but I can take that away, Kevin, and get a specific answer. And if I may, because I think there was a long list of questions there, if we can capture those in the minutes, then I can get specific answers to each of those questions. But I think what I'm hearing overall is that the report would benefit from more information around the audits, more information around performance and benchmarking that enables to be able to scrutinise the report, if that would be helpful.
It would be, yes. I'm very happy to forward or have specific questions. And finally, if I may, Chair, sorry, it's just the last bit on page 77 and 78, again looking at the police data, there seemed to be a real concern around missing children and why Baines was so high compared with other parts of the Avon and Somerset and what's being done to address that bit. And also the children being victims of crime and CP crimes, about why so high and again, what's being done to address those.
So certainly in the last 12 months we have reviewed our missing protocol in terms of who undertakes the interviews when children go missing. So that has been reviewed and updated, and that's been a really helpful piece of work. The numbers generally relate to numbers of incidents as opposed to numbers of children, which can read ever so slightly different, because it may be sometimes we've got a small cohort of young people who go missing frequently. So I would say that has been a positive development this last 12 months around the missing protocol. In terms of crimes, obviously working through the Youth Justice Board is where we focus our efforts in terms of identifying children at risk of. And what we have worked a lot this past 12 months is again to promote the Compass service, which is a service, a preventative service if there are any children at risk of being involved in offending. And we would want those children to be notified to the service as early as possible so that they don't go on to further more serious crime. We do have at times in Baines throughout the year, there are concerns about county lines, there are concerns around criminal activity that the services are working through all of the time. Appreciate that level of detail is not in the report, but we do work very closely with police colleagues around what that intelligence is.
Thank you, Mary. Did that answer all your questions?
Well, specific answers, obviously, but I'm happy to submit the questions if you like, Chair, separately.
Okay. Thank you. So I have Liz, and then Paul, and then Joanna.
Thank you, Chair. I mean, I share many of the concerns that Kevin has raised. And one of the observations that I've made from reading the report is that there's a whole new structure in place. And I just wondered, would measuring success benchmarking, as you've mentioned, would that make it different to the old one that we've had with more reviews built in? So I am assuming that is probably what's going to happen, and that's what you will bring back to the board. What is really worrying for me is the child protection figures. I'm looking at the child protection figures, not just the ones you've given us, but I've looked at the ones that the same ones, obviously, from the LGA and DFE, and we're the worst in the country. And this is where the review of child protection cases, which were reviewed, or child protection cases being organised, which were reviewed within the required timescales. So it's really, really quite bad. So just to make sure I'm making myself absolutely clear, these are child protection inquiries which result in the threshold being met for an initial child protection conference. We're not meeting those. We're meeting them between something like 34 and 45%, which are very poor figures. And according, as I've just mentioned, the LGA and DFE, we are the worst in the country for this. So really we're failing our children when it comes to child protection. So this is very concerning about these child protection inquiries where an initial child protection conference has got to be held. So that is quite concerning. And I wonder in some way is the training that Kevin mentioned, the child protection training, which is not meeting, I know you've talked about local targets and national targets rather, but not being met is all part of this, that if we're not looking at child protection and getting conferences together to look at child protection issues around children, then surely we are failing our young people. So it is quite concerning, the figures. I have looked these up, and I have looked them up on the LGA DFE, so they are correct, and I just wondered what feedback you have on those for me. Thank you.
If I may, could I suggest at the next scrutiny panel we're having the IRO annual report, if we can also include a focus on child protection, because the local performance figures are higher than what's been referenced in that report. But I can certainly ask the head of safeguarding to include an update in terms of the local performance.
That's great. Thank you.
Thank you, Mary. Paul.
Thank you. I've got two questions. One is how are disabled people, physically disabled people, catered for within this process? And the second one is you've got a lot of data, a lot of figures, and I do agree with the previous comment that it'd be good to have some more facts and figures on those. But are there any significant areas where there's a difference based on racial background?
Is that we would say, and we've referenced it earlier in terms of our youth. Can you hear me? I'm speaking to that. Sorry, I'm looking your way. So what we do know in terms of our youth justice figures, that we have an overrepresentation of children from BAME, and that also we've got overrepresentation of children with SEND. So those are the two areas from a youth justice perspective we do have the difference, and we have set up a subgroup just to look at that in terms of what more we can do about that overrepresentation. In terms of children with disability, our disabled children team works very closely cross-service in terms of supporting any children with disability. They're not specifically referenced in this report as such, but we could certainly ensure that's included in the next annual report. Thank you.
Okay, Joanna, you're next on my list.
Thank you. Thank you for your report. I have some questions. So self-neglect policy, you mention it, but you don't really explain it, and there doesn't seem to be any information about where that policy sits and what that looks like.
My colleague in adult services would answer better than me, but I will do my best to respond. So the self-neglect is a policy within the adults around. There has been a number of serious adult review over the last number of years where there was concern around the choices perhaps that people were making and or presenting as self-neglect. So there's been a lot of work done with our adult colleagues updating that policy, updating the guidance and updating the training. I could attach, there is a link, a lot of work has been done in the last 12 to 18 months around that, And we could ask my colleague Suzanne Westhead when they come to the November scrutiny to give an update, if that would be helpful. Yeah, thank you.
But there's that. You talk about this, about working together requirements and improving communication and information sharing, which lots of other people have mentioned in this committee. Yet there isn't any way of documenting what that looks like and where that's taken to, and if there is an actual outcome from that.
I'm sorry, is that in relation to information sharing in general, or?
Yeah, well, that seems to be part of your action for safeguarding and safety. That there is more improved communication and information sharing. It says something on page 15. And again, it goes to KPIs on page 16 and 18, of which there are lots of red lines on that seem to be that there needs to be a whole lot of work. So there's issues around that. My other questions would be in terms of going forward, where are actual children's voices in this? My experience during COVID is quite a lot of young people told me about terrible experiences they suffered from the police and being manhandled by the police because they were told that they shouldn't be in certain places. And there's a lot of young people now who really dislike the police. So there's lack of information about police and safeguarding and young people's experience of police and safeguarding too. That doesn't sit in this report. And also thinking about young people in domestic abuse situations, or if their parents might be in prison because of domestic abuse situations. Again, where is safeguarding sitting in relation to that? So that there appears to be quite a lot to be done.
So I can respond to two of those, if I may. In terms of the CYP voice in the report, so the Youth Forum attend the Safeguarding Board once a year, and they talk through what are their priority areas, and there's a challenge to the Safeguarding Board to respond to those areas. So we hear that voice very, very clearly. In terms of the subgroups, there's always a focus on the voice of the child or the young person, and certainly in the Youth Justice Board, we focus quite a bit around young people's experience with the police. And we have, as the Youth Justice, we have a child first principle, and we always start the meeting with hearing directly from a young person or a social worker who's speaking to a young person's experience. So it is an area we need to constantly be vigilant around in terms of what young people's experiences of, and we certainly, through that partnership, we scrutinise the data around stop and search and so forth. So I appreciate that level of detail is not in the report that's being presented here, but through the subgroups we attend to that in significant detail. Thank you.
Thank you, Karen. Thank you for the question, Joanna. Leslie.
Thank you. Councillor Hardman has outlined the concerns that I've got as well regarding the structural failings, really. It's a bit concerning to see which way the figures are going. I'm picking up the points also raised by Kevin on missing children. And if you look on page 41, the second paragraph talks about child abuse offences. The trend remains one of significant growth. Or what language to use? I mean, that's pretty shocking. What I don't see is what we're doing to actually change this. What awareness are we raising in schools? What actions do we have in there to make this a difference for children? And it says at the beginning of the report there's no equality impact assessment. And why is that? Thank you.
I'm happy to take those comments back to the author of the report in terms of the independent chair, but they're very valid comments. Thank you.
Thank you. Ruth, and then I think after me I'm going to draw a line.
So thank you for the report. I'm just looking again for the page, I think it was page 78, and it was the figures to do with child sexual exploitation and the fact that they've gone down, so, you know, that would appear to be a good thing, but then in the same paragraph you're actually then going on to say, but it, you know, it's very difficult to be sure in these sort of cases of hidden abuse So my question then comes out of that, given that you know that is the case, and you're saying that it'll depend on, among other things, on the effectiveness of activity to prevent sexual exploitation. So that's a very broad field there, but I was just wondering what are we able to do well, overall we want to decrease these numbers, but we don't want to decrease them artificially just because they're hidden. So what can we do to help, I suppose, children or people near those children to come forward?
And thank you. What we're always doing is looking to promote and ensure that everybody is aware of everybody's safeguarding responsibilities, that at the earliest point there's any concern to refer it through to children's social care and through all the other services. But we always need to be vigilant around recognising that unfortunately abuse and neglect has not gone away, and the nature of it does evolve and change, and certainly exploitation, criminal exploitation, is an area we really need to attend to. So I guess for all of us it's about remaining vigilant and supporting referring through at all times. Thank you.
Thank you, and that sort of leads quite neatly into my questions, one which was around online sexual exploitation and how that is then recorded. And then my second question is, time and time again, when we see the outcomes from serious case reviews, there is a recognition that more needs to be done on communication between different agencies. The protocols, etc., need to somehow be aligned with each other, yet it comes up time and time again as something that is recognised each and every time. And I know, that this has been the case for many years. How is that point being worked on? How are those various protocols being redesigned so that they can talk to each other?
Chair. So in terms of the online, I mean, that is an area that we roll out all of the training and the support around settings and families being alert to in terms of communicating. In terms of the communication, so there is a constant review of policies, procedures, what the training offer is, and about really ensuring that there is good, effective communication. I attended a workshop on Friday with Avon and Somerset Police, where they are looking at some of their systems of communicating and looking to improve their systems with the local authorities, which I think will be really welcome. They're looking at their victim pathway, and there's likely to be some improved tools that they will be using in communicating with us as we move forward.
Thank you. And I think going back to one of Kevin's points earlier, it'd be really useful to be able to demonstrate that there has been change, in that particular area as well as many other areas. Okay, so we are now on the item 11, which is school attendance and exclusions. So, Paul, would you like to introduce this item?
Thank you, Chair. I think Sarah's done probably a lot this morning of seeing the real scrutiny, and it's a real advantage, and congratulations to the whole committee for 2 hours. I think it was on my one item. I mean, it is an important role of the council, is the scrutiny role, and so I hope we'll take any feedback from you, Sarah, after the meeting. But so this report, I think it highlights in many areas average performance, but it does also highlight the fact that in terms of race, that there are real disadvantages around exclusions and suspensions. So at this stage, I'll hand over to you, Sarah, and good luck.
Thank you. I think probably rather than giving you my whole report, I'll just give you perhaps an overview and then take your questions. So if I start first of all around attendance, it's really timely that you've invited me to come and speak about attendance today, because some of you will be aware that obviously in August we had the Working Together to Improve School Attendance, which became a statutory document. And the clear outcome of this document is that it is everyone's responsibility to raise school attendance. It doesn't just sit with the Attendance and Welfare Support Service, and it very firmly sits right across children's services and all of our schools. As a team, we've worked really closely with our DFE advisor over the last year. We have a very clear local authority strategic attendance plan, and I think this is beginning to really show in some of our figures. When you look at our overall attendance, it is very positive. But of course, just looking at a single figure to represent the whole of the local authority is not what I'm here for. I'm actually here to really pick out those key trends and of course to identify areas that we need to improve. One of these key areas that I've highlighted in the report for you is specifically around our vulnerable pupils. Whilst our attendance for children in need is very positive, we do have a small target around our children looked after, around persistent absentees. This relates to 10 pupils. And actually, as we've already spoken about, we also have a target around those open to our child protection, particularly those who show severe and persistent absence. So rightly so, you're going to say to me, what are you doing about this? This is a target which sits right across children's services, and it sits in our children and young people's plan. So it sits at the heart of everything we're doing. We have a joint working party across children's services and education, and we're making sure that we don't only just say in our child in need and child protection plans that attendance is an issue, that actually we highlight really clear targets that need to sit within those plans, and we're encouraging our CP chairs when they come back to those plans to challenge everyone around that child as to what we're doing for attendance. We're making sure that advice is sought from the virtual school and the Attendance and Welfare Support Service, and regularly carrying out audits. I also send to my social care colleagues, the leaders of those teams, every term the data around the young people who are persistently absent and severely absent, and politely challenge them to ask them what are they doing about it alongside schools and, of course, the education settings. I've also raised for you that we do have a concern around attendance for those who are open to free school meals. We've already referenced today in the panel meeting the academic gap that we know exists in Key Stage 2. And when you look at the data, you can see that we have too many that are persistently absent. So actually, we've got nearly 40% of that cohort who are missing 10% of their schools. And for those of you that are actually educators, you'll know that sometimes this relates to being late. And actually, those key subjects are done first thing in the morning, so it may well be phonics or numeracy skills that they're regularly missing out on. Again, this is a target that sits across our schools, our children's services, completely. And we have a meeting later on this week, which Chris is chairing, to look at finding some really key outcomes as to how can we work all together to address that attendance gap. If I move now on to permanent exclusions, I have provided for you the data over the last 3 years. You'll see that we did have a rise in permanent exclusions in 22 and 23, but also I hope that you've noted that this significantly went down last year. When we have a look at our permanent exclusions, historically, we have had an issue around ethnicity. As you'll see in terms of our permanent exclusions, there isn't that clear disproportionality, but actually we've got very low numbers, so it's difficult to comment on those patterns. Within the local authority, we have a focused steering group around permanent exclusions, and this sits across a whole wide number of teams who are there to challenge some of those key trends and to make sure we are doing as much as possible. We don't have a behaviour support team within the local authority. This responsibility sits within MATS, but what we do have is very clear advice. So last year we introduced 2 education inclusion coordinators who go out to our schools and provide advice for any child who's at risk of permanent exclusion. We have 6 inclusion panels that meet every 25 days. I think mine started about 2 minutes ago that I'm meant to be attending, but that's fine. And then we also have, as we've already mentioned, the AP and the SEND advice service, all that's there to provide advice for our schools about reducing permanent exclusions. As I said, in terms of our permanent exclusions for last year, this is our internal data, but you'll see there has been a distinct drop in the numbers. So whilst we had 40 that were reported, only 29 were effective. So this means that only 29 actually went through the governance process, or perhaps didn't meet up to our challenge, and actually went through as only 29 as permanent exclusions. So we actually managed to challenge 11 of those. The area that we've really targeted within our permanent exclusions are those open to child protection and children in need. So in 22-23 we had 17 permanent exclusions, and last year we only had 5, and only one of those was child protection. We also had no exclusions for our children looked after, and this has been the same for 8 years. Everybody knows that it's my ultimate challenge to not have any permanent exclusions for children that are open to child protection plans, and that is my aim over the next 2 or 3 years. If we move then to suspensions, which was previously called fixed term exclusions, looking at the data over the last 3 years, you'll see there has been an increase in suspensions, which is in line with regional and national. But you'll also note that actually in 2021 we sat above both the regional and the national levels, and then most recently we sit below. So actually, in relation to those wider outcomes, we're doing very well. In terms of our suspensions for vulnerable pupils, if you have a look for our children looked after, we've had a clear target over the last 3 years to make sure that this is reduced, and it now sits below both the national and the regional levels. We do have an area for improvement around those open to children in need and child protection, and we want to reduce those suspensions. And then finally, if we have a look at suspensions by ethnicity, historically we have had disproportionality in those figures, and that still remains. So particularly for our mixed communities, so those who are mixed between white and black Caribbean, they are more likely to be suspended. We're addressing this through the Race Charter and the sharing of good practice that is going on, again an area that Chris is leading on for the local authority. Sorry, I appreciate it's a bit of a whistle-stop tour, but Chris or I are happy to take any questions.
Thank you very much, Sarah, and welcome to the panel. Okay, David?
Thank you very much. I've got 2 questions. Persistent absences. Is it correct that the commonest reason is infection and has been so for the last 4 years?
I'll be honest and say I'd have to go back and get that data for you to really dig into it.
Okay, thank you. And on page 108, and forgive me if it is in the report, I've just missed it, why is for kids with free school meals in socially economic disadvantaged households, why is attendance in Baines worse than our neighbouring authorities?
I think that's a really good question, and that's one that we are going to address with our CEOs on Wednesday and have a real think about what can we put in place to raise that, because it is a concern for all of us.
Fabulous, thank you. I look forward to hearing about that.
Thank you, David. Kevin?
Thank you, Dean. Thank you for the report, Sarah. David's asked 2 of mine, that's great. And my first one is around the general trends over the sort of 3 years. Yes, it's good that things are coming down, which is fantastic. And it might be that, in particularly the second question you asked, it might be the issue, the fact that things have only just started coming into place and whatever. But with suspensions and exclusions, the trend has seemed to be up from, if you took your baseline of 2021. And have you analysed the reasons for this? Is it school specific, or is it to do with other things that are outside of controls that you may have particularly, or is it, do you think, what have you come up with so far on the general trends?
I think it's a really interesting question, because the majority of suspensions are for persistent disruptive behaviour. And again, it's working alongside our multi-academy trust to look at what we're putting in place to really support that, what we expect from the multi-academy trust to put in place, from their behaviour support teams, from their educational psychologist teams, and what they expect from us as a local authority. In my opinion, what often happens is that we will get called in, and rightly so, whenever young people begin to wobble. And that's when I think we pull together some of those services and really have those conversations, and that's what we need to strengthen and what we're really working on through the inclusion panels.
Thank you. Again, this might be the delay in maybe spreading the good practice that you started. You obviously, you've got, as far as permanent exclusions and looked after children's concerns, you're doing a fantastic job on that. And are you applying similar things now then to the children in need and the CPs? And is that working, or are there different types of issues involved, or how does that work?
Yes, so my ultimate answer is yes. So just over 2 years ago, the remit of the virtual school was expanded to not just oversee our children looked after, but to also have strategic oversight for those open to child in need and child protection plans. So we have 2 advisory teachers that work alongside our social care colleagues to really target the importance of education that sits in those plans, but also to target suspensions. It has been really, really effective, and I think we can really see that in the reduction of those permanent exclusions. The issue for us is that funding was only ever given to us for 2 years. It finishes in March, so it will be interesting how the DFE move this piece of work forward, because I think nationally you can see the real impact of having the virtual school work alongside our most vulnerable pupils. So, as I say, it'll be really interesting over the next few months how the DFE look at how they're going to move it forwards.
So what are you actually bringing when you come alongside the school? What are you bringing in to make this happen? Because obviously that's the magic ingredient. Something is happening there when you are brought in alongside.
Yeah, so I think it's an interesting question, and I could probably talk about it for hours, never give like a teacher a free remit, so to speak. But I think, as always, it's challenge and support. So we always look at supporting twice as much as we challenge. We actually go into child in need, child protection meetings. We also support our social care colleagues. We've done a lot of training with our social care colleagues to make sure that when they're in a school meeting, they know the questions to ask and they know the protocols that should be followed. But ultimately, it's being an advocate, and it's actually sitting there with the education experience sometimes to challenge or to ask schools around what they are providing. And I think that's when we have the greatest impact.
So they're not saying to you, we have no resources, we have no money to do X, we have no money to do Y, how can we cope with this particular child in this particular scenario?
I mean, they'll always ask us for money, let's be honest, and it will always come back to that. But no, ultimately, the only way you're going to reduce permanent exclusion is for the whole team around the child to work together. And it's exactly the same for attendance. It doesn't just sit with the school. I don't have a magic wand, but probably between social care, between the virtual school, between home and the school, between you all working together is the only way that you're going to make it move forwards. But to have really clear actions that can be met as part of that plan.
I can see that logic, and that's great, and your challenge on it, but surely there must be something on resources. Somewhere on the line, when you're saying that somebody's going to bring something else to the table to make something change.
So I think that's where more wider we're using those resources. So we've already talked about introducing the SEND and the AP advice service, and in terms of do we use the inclusion panels, we have access to the EP service, but I can only fund in a way what I'm given, so to speak. I mean, I don't know if I missed anything there, Chris?
No, I mean, resources for schools is an issue, Kevin, as you know, and as it is for the local authority, we have to work with what we've got. I think space that we're filling there, which perhaps wasn't there before, is that advice that we're providing to schools, and schools are saying to us, actually really benefit from that support through the education inclusion officers. Somebody can spend some time with them and go, actually, have you thought about this? Have you thought about that? If we did this, what would happen then? So I think we are filling a resourcing gap, because that wasn't there before. Not, schools can't always get that, but we have certainly got a much better offer around providing advice and support to schools around behaviour, around exclusions. Sarah brings a wealth of experience around challenge as well, about asking, could we really do something more? Could we look at this again? Resources will always be a challenge, but I believe we are bringing a lot more to the table for our schools now through the education inclusion officers and through the SEND and AP advice.
Do you want one question, please, Chair? Very small question. The recent, you mentioned the working together on the attendance bit. There seem to be a number of interesting feedbacks, and with my governor hat on as well, listening to the heads reporting back on this, they seem to be in a very difficult situation of trying to, if you like, clamp down, and particularly in maths, it's easier for the CEOs to say, know this, know that, but actually they're working with the communities and parents, and it seems to be having a bit of adverse consequences or unexpected, unintended consequences, where you have parents now lying rather than say why they're being absent or what. Is that what you're doing, if like around attendance? Is that following a sort of know this policy, a very not no, clamping down, or is there other things that you're trying to work on that's subtly different to that?
So I think what sits at heart of that is those targeted support meetings that the Attendance and Welfare Support Service carry out with all schools on a termly basis. And I think it sits around the quality of that meeting, around really liaising with schools. Because it won't, and that kind of sits with our free school meals as well as our vulnerable pupils as well. So I think, I'm not sure that answered the question actually, sorry. Did it?
Can I just pop in there? There certainly is a big national drive around attendance, and leaders of multi-academy trusts are giving very clear messages from the DFE about getting attendance standards back up to sort of pre-pandemic levels. Ourselves, I think we like to think that our advice around attendance and around lateness and around for schools has always remained fairly consistent. We've had a fairly consistent team, and it is about putting that robust challenge in, but supporting when you can. But I take your point. I think a lot of head teachers and I think a lot of leaders of trusts and us in the education department have had a lot of pressure from the Department for Education to clamp down a lot more on attendance.
Perhaps that could be another question we could put to the regional director in due course. So next on my list I've got Liz, and then Ruth, and then Joanna.
Chair. Just to say, I very much welcome the inclusion of Sarah Gunner in the inclusion and attendance team, and know how well she's going to lead her team, because she's done fantastic work as the virtual school. I'm a virtual school governor, and as head teacher of the virtual school, she's done absolutely fantastic work in reducing permanently for the last 3 years the number of permanent exclusions. So I'm very hopeful that what we've said about our persistently absent free school meal youngsters, that will be tackled. And it looks like our permanent exclusions are coming down, but it now seems the area that we need to concentrate on, as well as all the others still to concentrate on, are suspensions for vulnerable pupils. Are we getting the full picture? Because we've only got data for 2021, 22, 22, 23, and I would just question why haven't we got 23, 24, and what are the figures like for these, if you do have them?
Yes, so we only have published data. We have internal data, but I've only shared with you the published data that's available from the DFE. The number of suspensions has increased again, but I can't comment in how that relates both nationally and regionally, because I don't have that data. But ultimately, we have to do everything we can to support inclusion and to avoid exclusion, and that's the real focus that we're having from the local authority.
Okay, so I now have Ruth and then Joanna.
Yeah, so thank you for the report. I don't know if this is so directly a question for you or maybe for Chris, but I'm just throwing it out there. So this is obviously all about school attendance and exclusions, and I'm just thinking, how does this all tie in with home-educated children? Because I know in some cases if parents might withdraw their child from regular school and decide to home-educate for various reasons, so that how that the link, as it were, and how do we, so maybe for a future time, it would be interesting to have some information about numbers of home-educated children in the district and what, services are available to support them, the families, and how do we basically measure success, because it's not, in educational terms, it's not just about exams passed at the end of the day, that's part of it, but and how do you do that with home-educated children? It's even trickier, I would suggest, for you as from the outside. Anyway, thank you.
No, I can answer that one quite quickly because I also oversee the elective home-educated. So numbers have increased. Again, I can find you the exact figure, but I think it's around 240. We have a fantastic, we have 2 advisory teachers who go out and visit all of our young people who are open to elective home education annually. They carry out a report and then they rate the report based on whether they feel it's delivering a good education or not. We keep a really close eye on that numbers in terms of how many vulnerable pupils are in that cohort. We have a very low number open to child in need and child protection who are electively home educated. And in fact, one of the things we've just put in place is some training for our social workers who support young people who are open to elective home education. So I feel that we have quite good effective oversight for our EHE community.
Thank you. But maybe another time, Chair, that might be interesting to have a bit more information about that. Sorry.
Yeah, I tend to agree. I think where we could also bring in those that, I'm not even sure how you'll do that, but those that we know are not necessarily registered within sort of a home education, to recognise them in that. And I guess that would also include perhaps boaters and gypsy and travellers' children as well. Yep. And also those who are receiving some form of hospital education as well. So I think we'll put that as a future agenda item. That's my proposal anyway. And I'm the chair. Thank you for that very good question, Ruth. So we now move on to Joanna, then Leslie.
Thank you for your report. In terms of attendance, and I've heard that in some cases people are late for school and then they get penalised for being late for school. So they've learned to just not turn up at all. So there's an issue around how schools deal with people turning up late and therefore how it affects attendance. The wider issue of attendance and the real pressure to up the numbers, I think puts huge pressure on families. And all I can say is my children have finished school last year and it was a relief because that endless pressure put on you really does affect all kinds of families in different kinds of ways. And I just wonder if we should question that sort of 95% attendance figure, which I understand is needed for good education. However, there are times when education people are expected to be at schools and then there's very little, in fact, happening, particularly like, for instance, the last week of term, when it's just sort of sitting in front of videos. Anyway, the other question I have too is on ECHPs, which you've heard lots about today. So if we know that 3/4 of people have yet to have their ECHPs, how does that affect attendance and whether they're going to go to school or not? Because if they feel that they haven't been listened to and the system isn't in place, what then happens? Do they stay at home and etc.? And then my final question is, what happens to someone who is permanently excluded? And what is the impact for them on education for the rest of their life? And should we even be allowed to do that?
Oh, that's a good question, isn't it? So I think, first of all, around being late and the difficulties for families, I think it's really important schools know their families and their pupils. So it's really clear around the coding that they're using in the registers, the reasons for being late. So it might well be an accepted reason why they are late, and that's part of the training that our Attendance and Welfare Support Service do with schools to make sure that that coding is correct. Because for some young people, having a part-time timetable is the right thing for them. For some families, it's very, very difficult to get there first thing in the morning. So again, it comes back to that conversation around the whole family and actually how are we coding that lateness to show that it's not penalised where it is for the right reasons. So that really comes back to schools and everyone knowing their families and working together and making sure we've got that coding correct. So where the Attendance and Welfare Support Service go out on a termly basis, they will ask around that coding. And for example, where a child has been late every morning for 2 weeks, they'll query that with the school. Not in a challenging way, but actually saying, what's the barriers for this young person to get to school? Should there be an attendance support plan in place for those young people? Is there wider services we should be accessing? Should we be looking at early help or something like that? So I think there's a real key around attendance coding, and you're right, not penalising parents, because sometimes they can't get to school for the right reasons.
Challenge that it's not penalising children, because in some cases they are given detentions when they are late, and that then sets them on a train of like, well, why am I even bothering to get here?
Yeah, and again, I think that's something for our Attendance and Welfare Support Service to unpick with schools where they see those patterns in attendance. In terms of when a child is permanently excluded, so the process that happens is we're notified in the local authority when a child is permanently excluded. The first thing that happens is that my alternative learning team will look at the paperwork that has come through. We will review it. We'll have a call with the school to see whether we feel the permanent exclusion is appropriate. We'll have a look at whether they've got an EHCP. We'll have a look at whether they've got social care and make sure that all areas have been explored before we pursue the permanent exclusion. The next thing that happens is that we allocate Day 6 education, so we have to make sure that there is a full-time education in place from Day 6, so the alternative learning team do that. The permanent exclusion is then reviewed by governors. It goes to the governing board and they decide whether they're going to uphold it or whether they're actually going to reinstate. And the Attendance and Welfare Support Service will support those meetings and make sure that the governors have got a clear pack of advice around why a young person is being permanently excluded. If the permanent exclusion goes ahead and it is agreed, then our young person is in our alternative provision, and then as soon as we feel they are ready to go back into school, we will make sure that school applications are put in place and we support them back into school as soon as possible. Often part of that process is to look at unmet SEND needs, because sometimes once a young person has been permanently excluded, and then when they reach our AP, one of the first things that we'll make sure happens is that any unmet SEND needs are explored. There is a very, very clear correlation around young people permanently excluded who then go on to get EHCPs. And again, that's the piece of work we're trying to do much earlier through the AP and the SEND Advice Service and our Education Inclusion Coordinators. Because actually, if that piece of work was done earlier, could we have prevented what happens further down the line? Does that answer all of them? It's okay.
Thank you very much, Sarah. I just have one more question I wanted to ask, which I think follows up a bit from what David first asked around when a child is sick, and obviously there's been quite a lot of stuff in the sort of national press very recently about medical reasons and how schools are being reasonable around accepting that as a proper reason for absence and no longer demanding a sick note from the doctor. I would hope, and this is what I'm really seeking, is some sort of assurance from you that we have embedded sort of reasonableness within our schools and practices.
Yes, and I think our Attendance and Welfare Support Service would very much support that. I think some of the information that came out recently in some of those reports was really quite shocking, and I know that our schools are supportive. But equally, where a young person is significantly unwell, we will make sure that we get that medical opinion as soon as possible to guide us around what is the right education for that young person at that time.
Thank you, Sarah. And I think you might be the only person in this room, actually possibly ever, that's actually been referred to as the magic ingredient. So, so that's something to take away. And hopefully you can report back to Paul that we've not been too challenging.
No, thank you.
Right, so our last item is on the panel work plan, and I'm so sorry, Sarah, you're going to have one more question from Leslie because I left her out.
Thank you, and thank you for the report. It's good to see so much detail, which we're often missing. However, it would be helpful to see a ward breakdown of where these figures apply to. We had a discussion earlier on, you probably heard it, around free school meals, and the food insecurity report said there's around 70% of our children on free school meals, and we don't know how many are entitled but don't get them. So which wards are we looking at, and what are the trends? And then the other question around that is going to be what action? I did have a look at the equality impact assessment, and I'm a bit surprised. It does mention around ethnicity, there being a negative impact. It doesn't actually say it's a negative impact, which talk to, and there is some action around that. But we also heard Councillor Jackson talk earlier on about disabled people, and yet in here there is nothing around, apart from send, but there's no data, there's no nothing on how this impacts on children. So if you are neurodivergent, you have another disability, how does that impact on you attending or not attending school, or ending up then being excluded because it's all too much and you can't cope with it? Those figures really ought to be there, and there ought to be actions to follow that up. If you talk to people that are neurodivergent, you will find that their experience of school has usually been pretty horrific, and that the support they required has not been there. And I'm just wondering if we could work on some of that we might bring down some of these figures. Because at the end of the day, when you look at the discussions we've been having today on free school meals, on poverty, etc., across Bath and North East Somerset, it really looks like that we're failing all the way around, our young people. And a question, not necessarily for you, Sarah, but should we be looking more at the budget in 25-26 on how we can support this work? Thank you.
So, yes, I can easily provide you with data around wards. I can also provide you with data around maths. It is something that we do internally and look at those trends. I think I was just aware of how long the report might have got if I'd cut it every single way possible. And again, I would also agree around EHCPs. As a mum of a disabled child, it's something that's very much on our agenda whenever we review exclusions, suspensions and attendance. And again, I'm happy to include this data next time that I report for you, with pleasure.
Thank you very much, Sarah. Okay, and I'm definitely closing off that item now, so thank you again. So the last item on our agenda is the panel work plan. Obviously, we've added a few things from this meeting to that agenda. So we've got home education, hospital education within that, and I know that there were some other items too. Is there anything else that has occurred to anybody that they want to add onto our list? Ruth?
Was one of the other things to do with social prescribing? Something a bit more about that?
I think that was on. I'm sure Mark made a note of that, but we can make sure. Social prescribing.
Should we be starting to think about the budget?
I think we should be starting to think about the budget. Yes.
But how early can we start? Is the big question.
A few months ago. Okay. Yes. No. It has come up many times. I think in our planned meetings are in January, but I think we might be looking at some of this in November. That's a bit of a standing item. Anything else anybody else wants to add? Obviously, if you do think of anything in between times, then please make sure that myself and Mike and Kerry are aware so we can put them on our agenda. Councillor May, did you want to add anything?
But only an apology. I had a Teams call that I had to go out for, so I wasn't being disrespected to the committee. So apologies, Chair.
No, that's absolutely fine. I've arrived back just in time to me announcing that our next meeting is scheduled for the 11th of November, but there will be a time change because obviously many people in this room will have events to attend for remembrance at 11 o'clock. So it is, I believe, scheduled to be around about 12:30, 12:15, 12:30, but we'll make sure everybody is cited on that change as well. So until then, I think I will close this meeting. Thank you everybody for your attendance.